We'll be starting in just a couple minutes. Thank you for joining this morning. We have a poll.
Okay.
All right, let's get going. Good morning, everybody. This is our HIPAA compliance and executive leadership overview. And even though we call it an overview, it's 2 hours of jam-packed information. So we'll be covering a lot of issues and items in HIPAA today. The agenda is out in the handout area on your webinar, and everyone here in the room has a copy, hopefully. There's some references on there, resources that I wanted everybody to have, several links that we'll be discussing in the class today, as well as for the class this morning, there is the business associate agreement, as well as some contingency. Oh, no, we decided to put those out on the website.
They'll be on the website after the webinar.
Excuse me about that. So what we're going to be covering this morning is security and privacy, the 45.
Introduce.
I wasn't going to take the time for introductions, if that's okay.
Maybe you should say who you are.
Oh, okay, sorry. Yeah, I should probably do that. Sherry Silvera Moliere with XPIO Health. And we came in to do this HIPAA overview training and then a technical class this afternoon. If you take the exam and pass that exam, you'll get your certificate for completion of the course. Thank you, Shel. Okay, the agenda today, we have a lot to pack into 2 hours. The agenda today is, like I was saying, we're going to be talking about 45 C.F.R. We're going to be looking a little bit at the comparison between that and the California laws that we in California have to abide by. We're going to look at some of the rules. We're going to talk about breaches. We're going to talk about 42 C.F.R. a little bit. We're going to talk about policies, procedures, and plans that are required as part of HIPAA, your staff training, and end up with some compliance strategies that you might be looking at as you go back to your agency. If you look at the first slide there, this training and the content is all effective as of today. As we all know, governments love to change things, and HIPAA, you'll see, is always evolving and changing. So just be aware of that. Okay, so now we wanted to do our first polling question. So the people on the webinar will be completing the answers. We in the room here can just kind of, raise your hand or shout out. So, Kelly, if you do our polling question.
So the poll has been deployed. We cannot see it.
Oh, we can't. Okay.
No. What is your role at your organization? And then the choices are clinical management, business management, IT management, or other. I don't know if we want to do a show of.
Yeah, that might be nice. So who's clinical side here? Okay, good. IT. Okay. What are the other choices?
And other. Clinical, business, IT, and other.
Business, so contracts, okay, that kind of thing. Okay. Anybody in that other category? Juanita? Okay. Okay, so let's look at the poll.
All right. So we had 34% is clinical, 15% business, 37% IT, and 15% other.
Okay. So majority clinical, is that what you were saying?
Mm-hmm.
Okay, great.
And then if you can click back on your screen.
Oh, there. There we can see him down there. Okay.
Yeah, but click on your screen.
On your screen itself.
Yeah, because I took over control of the webinar.
No. Sorry, guys. We're trying to figure out how for me to get back. that?
There you go.
Okay, good.
So I think we'll have to deploy the polls from your computer.
Okay, good. Okay, everyone I'm sure has heard of HIPAA, so this is our overview here. We're going to be talking about HIPAA started in 1996, signed in by Clinton, and it has progressed throughout the years. The slide here shows some of the, under the Title II law, there's many different parts of HIPAA. We're going to be focusing on the security and the privacy sections of the law today. If anybody's in billing, you probably have been dealing with 837, 835, the standardized format for transactions. That's also part of HIPAA. But we won't talk about that today. All right. HIPAA stands for Health Information Technology for Economic and Clinical Health Act. It's a mouthful. It was also included or updated in the ARRA Act of 2009. So things are progressing and things are always changing around HIPAA. The incentives are part of that are around healthcare technology. The whole thing around adopting electronic medical records or electronic health records, which I'm sure we're all living in that today as well. Meaningful use was included in ARRA. And what they decided to do is look at the rules around HIPAA and added some teeth to them. They looked at penalties and incentives and trying to get folks, now that you're looking at your electronic health records, how can we make sure you're securing that data? Because now we have more data that can possibly be exposed. If there's a wall of shame, I don't know if how many people have gone out there to look at the wall of shame. There's a link there, and I included it hopefully in the resources. Just search on wall of shame. Anyone that has a breach of more than 500 client or patient records has to report that to the secretary, and your name is placed on the wall of shame. No fun. Some of the other things that changed for HIPAA were the Notice of Privacy Practices, NPP, they're called sometimes. The Business Associate Agreements, or BAA, making them responsible as a healthcare provider. They updated policies and procedures, what you're required to have in those to be compliant. And we'll talk a little bit more about audits. The government's really putting a lot more money and effort into auditing healthcare providers. They also looked at the breach notification rules, and we'll talk more today about what a breach is, how that's defined. They've changed when you have to report a breach and how that's reported. They talked about privacy, patient rights. There's mandated and enhanced security standards. We're going to talk about some of that this morning, and then this afternoon in the IT group we'll talk more in detail about the security rule. Like I said, there's penalties, and they're pretty large. They also apply to the person that was responsible for the breach as well as the agency. So they'll hit many people. The Office of Civil Rights, or they call it OCR, is responsible for the enforcement of HIPAA, and they work in conjunction with the state attorneys general's offices. And the idea is they're all working together to investigate breaches. I kind of threw out a term, business associate. You might have heard of that before, maybe not. So this is just a slide about some definitions that you should be aware of around HIPAA. A covered entity is a healthcare provider, someone that actually renders services to patients or clients. The specific definition is includes doctors, clinics, hospitals, dentists, nursing homes, pharmacies that transmit data. They're considered covered entities. Healthcare clearinghouses, health plans, anyone that provides service. So a lot of our groups have contracts with, say, a nursing group or folks to come in and do sitting with people that might be a risk to themselves or something like that. they're all considered covered entities. They're providing services. On the other hand, business associate is someone that works in conjunction with that covered entity to help provide services. So official definition, functions on behalf of the covered entity and involves use of or disclosure of identifiable health information. Some examples might be you have a billing vendor that you work with, or a coding vendor. Or on the IT side, you might have somebody that comes in and helps support your servers or your network, or does testing on those for security. Those would all be considered business associates. And we'll talk about what you have to do around those contracts in a little bit. Kind of all related to the program in general, HIPAA mandates that you have people at your organization that are responsible for certain parts of the HIPAA compliance program. So this is a slide about the security roles, they're called, and what the names of those. We have more detail about responsibilities that I really should be reading to you. I'm not doing my slides very well, am I? I'm just talking. Covered under the 45 C.F.R. You can have a single person with multiple roles if your organization is small, or if that makes sense for you. The idea, though, is you have people across the organization that are part of your HIPAA compliance. So there's a security compliance officer. They're responsible for developing and implementing the security policies and procedures. They're also responsible, as I see it, to manage the whole compliance effort at your organization. They work on the staff assignments, test results on your disaster recovery, kind of, your plan testing, that kind of thing. They're sort of in charge of the whole ball of wax there. The privacy officer, they're responsible to ensure that you're in compliance with the HIPAA Privacy Rule. And we'll talk a little bit more about that later in the class today. Workforce security manager, they're typically kind of an HR function. They're going to be responsible for your background checks, your assigning roles to your staff as they come in. What data are they allowed to access, or what are they doing in their job there? IT security manager, they're responsible for implementing the security rule and the security standards as part of the HIPAA regulation. Incident breach manager, they're responsible for creating and implementing security incident tracking, monitoring, and reporting, working with legal if they need to. And physical security manager, they're more of the, doors are locked, your staff have key cards, you know that people are accessing areas where there's PHI if they're allowed to be there. If they're not allowed to be in there, they should not have access. Sometimes that's an IT function, other times that's an actual physical, facilities, kind of a person at your agency. But the important thing to take from this is you should have someone responsible for these roles and the responsibilities behind those roles. So we've talked a little bit about identifiable information. Kind of the buzzword is protected health information, or PHI. People may have heard about that, and you might be living that today. This is a slide of the 18 different items or data points that are considered PHI under the HIPAA rules. The important thing here is it's one or a combination of those that are called PHI. So, for example, if you expose your client's name only, or email address only, and they consider that a breach, that would be a breach of their PHI. It doesn't have to be in combination with anything. Important thing here is it can be paper, it can be electronic. When we talk about electronic PHI, we usually say ePHI, today we might just say PHI and understand that it covers kind of all those media, as well as talking about your clients in the offices, in the hallways, you know, that kind of thing. Kind of interesting here, the last bullet, age greater than 89. The thing to think about there, and some of you folks may come from smaller counties or smaller geographic areas. So if you put out on your website, you know, a marketing piece, you're really proud of what you're doing, and you say we have, you know, our 89-year-old man who lives in, you know, Tulare is very happy having services here. His life is better. And you haven't gotten a permission or disclosure from him to release that. Somebody in Tulare might go, oh, I know an 89-year-old man named John. I wonder if that's him. You may have exposed John's privacy or his PHI. So the idea is just to think about it. We all try to do our jobs and try to protect our clients' information as best as possible, but some things might be falling through the cracks. So what kind of things do you have to consider as protected? So this slide is talking about, it's their medical records and other, they call it individually identifiable health information. Another way to say PHI. Used or disclosed in any format, in any media. We already talked about that. Oral, written, electronic. And so what it also covers is data that you might bring into your chart from maybe a prior treatment provider, the person referring the client into your agency, anything that was created by you, created by someone else, forwarded to you, even for payment, treatment, and operations is all considered PHI when it comes into your door. I have a poll, but I'm afraid to do it. Let's see. Okay. 4.
Okay, there you go.
Launch. Okay. Good. Okay, so the question is, what best describes your control of PHI today in your organization? So the options are in total control. I know where the ePHI is, but paper is different or more difficult, and we need some help figuring out how to manage that, how to control our PHI. So what do you all think in the room here? How about in total control? Okay. How about, you know where the ePHI is, but the paper is a little bit more difficult? Okay. And then we need some help. We should really take a look at that. Okay, nobody here. So it looks like it's kind of similar to online.
So go ahead and close the poll.
Okay. Looks like the majority is. So you feel like you have control of your electronic PHI, but paper might be a little challenging, huh?
And then if you hit share up there,
okay,
then everyone can see that's viewing the webinar.
Okay.
So I can read those, or you can see them.
Okay. So 26% in total control. You know, as I just mentioned, over half feel like you understand you've got control of your ePHI, but paper's a little different. 21% saying we're kind of starting from scratch. We want some help figuring it out. One of the requirements of HIPAA is that you have control of your PHI. One of the questions an auditor might come in and ask you is, where's all your PHI located? Where's it live? And you would have to pull out a list of all your software. And that includes, if I've got a database, an Excel spreadsheet on my local drive that I keep, I need it to do my business, you need to know about that. Because if the auditor comes to me and says, oh yeah, I have a spreadsheet on my computer that my IT guy isn't sure about, ding ding, that's a problem. You need to also know the devices, including desktops, laptops, your phones, if you have smartphones that are allowed to access email at your organization, those are also considered possible sources of PHI or ePHI. So, you know, it's, let's see now. Now I just need to hide that, right, and show my screen. Is that good? Okay. So, it's important to be in control of it. Any questions so far? Should we take a minute to look at any questions that might be either on the web or here in the class?
I think you need to go ahead and
show your screen sharing.
Yeah.
Okay.
It's not showing up.
Yeah, you only needed to do that because I had control. So,
There we go.
The only question we have related to the presentation is it's only a fax number. Is that a breach regarding to PHI?
Mm-hmm. Fax number was one item on that list of PHI. So yes, if a fax number gets out, somebody finds it, that could be a potential breach. Now understand the client has to complain about that for it to be a breach, or someone in your organization has to say, wow, you know, I faxed something to this fax number and maybe it wasn't their data, kind of a thing, you know. So yes, one or a combination of all those items on that list of 18 are considered PHI. Okay, so covered entities here. We talked a little bit about that definition of covered entity and business associate, right? So this is going into a little bit more detail about what a covered entity is permitted to use and disclose. So we all have to do our jobs. I think the government understands that. They don't want to make it too hard on everybody. So you can disclose PHI to the individual. You can disclose PHI for treatment, payment, or healthcare operations, sometimes called TPO, right? And then you don't have to get a disclosure or an authorization from your client. Some people do that just in your, you know, accepting treatment. I want you to know I'm going to be exposing your information for billing or that kind of thing. But you don't have to get a written, signed consent for that. And then, you know, if you have maybe a grant funded project or you're doing some research at your organization and you're going to be using data, you can de-identify that data and use it without disclosing that to the client. Now, the business associate, you're going to be, if you have a business associate, most of us do at some point, you're going to be entering into a contract with them that has a business associate agreement, very specific language about what the contract is for, what they're allowed to do with the data that they have access to or not do. And you're going to be very specific there about what they're permitted to do with the PHI. You have to have the business associate agreement to be in compliance with HIPAA. So think about it today. One of the things to think about, take away, is a list of all your contracts that you understand they have access to your PHI. And make sure, go home and check those contracts. Now, we talked about the business associate rules, and HIPAA changed in 2013. So the government saw that a lot of the breaches were happening by business associates because originally they weren't required to follow the same rules. So that all changed. So now a business associate is required to follow the same rules and regulations as the covered entity. Some of it doesn't apply, you know, like notice of privacy practices, that kind of thing. Most likely your business associate won't have that unless it's some kind of an arrangement you have with them. So that's a good takeaway. Go check your contracts. One of the things that were enhanced or expanded were the patient rights under HIPAA. So this is a kind of a list of what your clients have a right to see or do with their information, with their medical record at your location. They have a right to see it. They can get a copy of it. You can charge for that, but they have the right to do that. They can request amendments to their record. So let's say they get a copy of it and they say, no, that's really not true. I didn't say that. That wasn't what I meant. You know, whatever the case, they have a right to do that. You don't always have to accept that request for an amendment, but they have the right to ask you for that. They can request disclosures be prohibited under certain circumstances. Just a couple here. If they're private pay, you know, they can ask you not to share that with anybody else. Around marketing and research, they can tell you, no, I don't want my data included in your project. They can authorize, or they have to authorize, disclosures. So not anything around treatment, payment, and healthcare operations, but some other disclosure that you've made or you want to make. You have to get them to approve that. They have the right to receive the notice of privacy practices, and probably that happens at your admission procedure. And that explains what a breach is, how they can complain within your organization as well as out to, you know, the government, state, and federal level. They have a right to get an accounting of any disclosures you've made, not the TPO or the treatment payment operations, but, you know, if you've sent their data out to somewhere else, they can ask for a disclosure. There's rules about timely notification of breaches. So if the staff come to you today and say, well, I think something may have happened, you do your assessment, and yep, there was a breach, then you have a right to tell your client that there was a breach. They have a right to ask you for secure communications. I only want you to call me at this number. Please don't email or mail anything to my house, that kind of thing. And it's all around their confidentiality. So HIPAA sits at the federal level, right? Every state has the right to do essentially whatever they want, right? And so our challenge is trying to figure out which rule we have to apply or we have to go by. The law states that the most stringent or the most strict trumps the other. So if you come from a state where, you know, basically your rules are pretty lax, or that it just says follow HIPAA rules, then you know that all the HIPAA rules and regulations are appropriate for you. In our state, California, there's some other laws that are in effect. So, for example, the California Confidentiality of Medical Information Act, CMIA. There's a couple others I found. Information Practices Act, Patient Access to Health Records Act, and Insurance Information and Privacy Protection. Also Title IX and some other laws that, you know, come into our lives every day. So what I did is I just took an example from CMIA and wanted to show you kind of that analysis. Now, your legal might do this, have done this already, or you might go back and say, have we done this? Somebody really should do this. It really kind of is a legal task. So this is coming from the California Hospital Association. They had their lawyers go in and look at HIPAA compared to CMIA. So this is just one piece of HIPAA. HIPAA permits covered entities to use or disclose PHI to the extent that such disclosure is required by law, complies with the law, and covered entities must comply with specific disclosures. So in the law it says if you have a child abuse victim that comes to you, you can report that, right? You can go ahead and do that. There's some language about that sort of thing. Our state law says from CMIA, it permits disclosure of information where such of a disclosure is compelled by a competent legal authority or process as part of our civil law. So then what CHA did is they looked at the two detailed, you know, languages of the laws, and their analysis was HIPAA permits California providers to continue to comply with most required disclosures under CMIA. So in this example, you'd go to CMIA and say, okay, what am I allowed to do here? They're saying, you know, it's fine. You can follow that. Sounds like they're very similar. So as you can imagine, it's a task we all have to do. We have to know what's required by California and compare that to HIPAA. And like I said, you always want to follow the strictest or the most stringent. Now, I do have a link in the resources area on your agenda to take you out to that full paper. It's really interesting because they go through a lot of the HIPAA rules and do that same kind of analysis. I had another, there's a preemptive analysis chart, patients covered by CMIA and the resources link. So actually, it's one of the resources on your sheet, and we're going to be putting that document out on the website, right? So all the documents that I referenced today in class will be available on the CIBHS website.
Including the presentation.
Including the presentation. And when will that be available?
Probably the first of next week.
Okay. So,
and a link will be sent to everyone.
Okay, great. So I'm sure everybody heard you, right? Because it sounds like the microphone in here is really good. Any questions about what we've talked about so far?
Oh, yeah. There was another question about the fax. Is there a difference between fax number and fax document in terms of PHI and breach? If in the hallway I only talk about the fax number, is that a breach of PHI?
Yeah, we're getting down into the weeds, huh? I mean, technically, yeah, it would be. Would there be a risk of someone identifying that client just from a fax number and you didn't say anything else? Probably not. You know, so if somebody came to you and said, you know, privacy officer, I know a breach occurred because I heard Sherry say somebody's fax number in the hallway. So then you as a privacy officer would do your investigation and you'd find, was there anything else said? No. Was anybody else's name or anything? No. And you probably wouldn't have to report that. But it's a good exercise, and you would document it and have it in your records that, you know, you did your analysis.
And I would say, too, it depends on if you were having this discussion in your place of business where the service is delivered, and it's with the people that need to know or involved in the treatment, that's okay. But if you're in the hallway in a mall and there's strangers around, that's probably not okay. So if there's a gray area in there, certainly, but it's a contextual thing.
Mm-hmm.
So it's circumstantial.
Yeah, good point. Good point. Okay, we're ready for the rules. Everybody, stretch. Everybody on the phone, too. Stretch. Lift up. Stretch your arms. Yeah. What?
Gina's ready for some exciting stuff.
Yeah, right. This is so exciting. I know. It's like sludging through quicksand. I know. Thank you. Good. We have to know it. Okay. So we talked about this class will cover security and privacy, really, as part of HIPAA. So there's the security rule is one part of our discussion today. And that's really looking at the electronic PHI. So when you think about security rule, even if I say PHI, I'm really meaning, oh, thank you. I'm really meaning ePHI, because that's really what the security rule is thinking about right now. It sets a national standard for the protection of health information, the use and disclosures of PHI, and standards for the rights of your client's PHI, and how their health information is used. I like to say, you know, we treat our clients with such care and concern about their confidentiality. We want to treat their data with the same kind of care. Because if you happen to release their data inappropriately, they're going to lose trust and faith in you as an agency, possibly you as a caregiver. You know, there's a lot of implications around it. So, in May 2005, They implemented the security rule. That was tied to the whole, now we're trying to get everyone into the electronic health record mode, and we want to make sure all of our infrastructure and our technology is secure too. So the security rule covers access control. Who's allowed to access PHI? Antivirus, anti-malware. How up to date are you with that? Asking for strong passwords. You can't just have your kid's name and their birth date as your password kind of a thing. Remote access, rules around that, allowing folks remotely into your network. Locks on doors, we talked a little bit about that, key codes. Technical security, we're going to go into more detail on that later this afternoon. Your backup and recovery plan, your disaster recovery plan, sometimes it's called a continuity plan, but the whole idea is how are you going to keep your business running if a disaster occurs, or if your servers are down, or whatever. The pandemic flu, that was a big one years ago when I was in IT management. And having your risk analysis done. The security risk analysis, we'll talk a lot about that later this afternoon, but it's a requirement as part of your HIPAA compliance. Sure, hopefully it's not too small for you to see in the room. This is actually part of the C.F.R. regs. That stands for the Code of the Federal Register, by the way. And it's under Title 45, Subtitle A, and all the other subchapters and this and this. This is the part that talks about security. So what they're looking at is applicability, definitions. They're looking at your physical, administrative, and technical safeguards. We'll get into more detail on those this afternoon. Your policies and procedures, dates around your compliance, and you thought that was all, right? You have, again, your risk analysis, risk management. So that means, let's say you do find there's a risk, and you should always be looking at this. How are you going to mitigate that risk? Your sanction policy, and that's around your workforce. You have rules around how they use the PHI, and if they breach PHI, what they're supposed to do, and then what happens if they don't follow the rules. How you respond to incident reports or breach reports, kind of like what we just went through with the fax number thing. Again, your backup, your business continuity plan, your media disposal and reuse. You should have policies and procedures about that. Having a unique user ID. Again, business associate agreements, and then your written policies and procedures. Any questions about that? Security rules. I know it's a high-level overview. Like I said, later today in our technical class, we'll get into more detail on those. Anything on the web we should answer? No? Okay. So now we're going to switch over to the privacy rule bucket. The goal of that rule is to protect your client's PHI and to use it appropriately. And this is the rule taken right from the C.F.R. So the government's telling us that we really need to take care of our data for our folks that are coming in, or our privacy of our individuals. I just took a section out of the 45 C.F.R. again, just to kind of give you a reference point. I believe I have a resource link in the agenda to get out to these sections, but you can just query or Google any of these specific rules, and you'll get lots of information out there. Remember what we said, it covers both paper and electronic privacy, as well as oral communication. Some of the things here to look at are the NPPs, the authorization that a client might give you to disclose information, how they can access their PHI, The accounting of disclosures we talked about, that's kind of under the privacy rule. That kind of thing here. Is it too hard to see? I think it's okay, huh? So now we know we have to secure healthcare, their PHI, their data. We have security rules we follow. We have privacy rules we have to follow. And that's all because we want our clients to trust that we're caring for their data. Also because the government's looking at us. And they want to make sure we're abiding by the rules. So this is a quote from the Department of Health and Human Services Office of the Civil Rights Director at that time, December 2012. He says, now we've moved into an era of more assertive enforcement. And so they have. There's a lot more money budgeted now for audits and breach investigations. They did the Wall of Shame. You know, there's rules around what you have to report and when. So we talked a little bit about breaches. This is the definition from the law. An impermissible use or disclosure under the privacy rule of PHI is presumed to be a breach unless the covered entity or the business associate, as applicable, demonstrates there's a low probability that the PHI has been compromised. So kind of like we did with our facts example. Be part of your analysis. What's the probability that that client's privacy could be breached from someone saying a fax number in the hallway at the clinic? Nothing else was said. Pretty low, right? If you breach more than 500 patient records, you have to report that to your local media. And it can't just be on your website where you put it in, 8-point font. We had a breach. It has to go to a reputable newspaper in your area, which isn't fun. And then, like I said, you have to report that to the secretary, who then puts it on the Wall of Shame. Hopefully you can read this okay. These are just some key findings I found. This is from, I think it was probably taken mid-2015, so not too long ago. They did see a reduction in the number of breaches, so that's a good thing. But, however, it affected many more people. Healthcare data breaches, 110 of those so far. I'm sure it's much more than that, but that's what was reported. Hackers have stolen over 92 million records so far, and this was probably about mid-2015. Only 2 business associates reported data breaches in 2015, a reduction of 95%. Now, if I was looking at this data and I had some kind of control, I'd say red flag, right? Nobody's reporting. And what the recommendation is, of course, but I think it's really good practice, is you're monitoring all that at your agency. You know what you're reporting. You're doing your investigations. If you're not sure or if it is reportable, you need to report it. And I put the link in the resources about the site that you do report your breaches to, because what they're saying is we want you to report more than less. It might not really work out to be anything important, but take that effort, because in this case, I'm sure they're going to be looking at all, business associates. Okay, so following a breach, you must provide notification to the secretary, and like I said, in certain circumstances to the media. The business associate has to notify the covered entity, so they don't go directly to the secretary. They work through the covered entity. And in the HIPAA rule, it says you have to notify within 60 days following the breach. California, it has a 15-day maximum. They just changed that. I think it used to be 5, actually, in California, and they increased it to 15. And I just put the link there for you to reference. And like, we'll have access to the PowerPoint, so you'll have that link, next week. Now, let's say you've done a breach and it's determined that, yes, it was dangerous, you did, expose client privacy. There are penalties. So and it kind of takes a range, and we'll show you. I think I have that table in here next. But basically, covered entities who knowingly obtain or disclose PHI can face up to a $50,000 fine, as well as 1 year in prison. So that means you're knowingly breaching. Offenses committed under false pretenses, it goes up to $100,000 and 5 years in prison. And then if you're really bad, and you're going to sell that data, like in LA, if you have a movie star or some kind of a celebrity in the hospital. In fact, weren't people fired over Britney Spears data? I think so, yeah. Yeah. I mean, you never know. Wherever we are, we might have VIPs. We might have somebody in the area that's admitted. And if somebody decides they're going to sell that, the penalty goes up to $250,000 and 10 years in prison maximum. So they really have a lot of teeth around these breaches and penalties related to that. So this is just another way to look at the penalties. This is a table. At the very minimum, you didn't know about it. Somebody made a big mistake. You did your due diligence. You've reported it. You've done what you needed to do. You might get a $100 penalty, maybe up to $25,000 for repeat violations. But the maximum is $50,000 per violation, with an annual maximum of $1.5 million. It can go higher than that if it spans several years, or, And you see at the bottom, that's where you get the $50,000 per violation with the annual of 1.5. That's just the minimum. Willful neglect. So the takeaway here is, get serious about your HIPAA compliance program. Don't be in that willful neglect category, right? Be making your efforts to understand the rules and follow those. Any questions so far about penalties or breaches? What are we doing? Oh, we're doing good. No? Okay, nothing in the room? All right. I have another polling question. All right, we're going to do another polling question. And let's see here. The question is, our agency has an alcohol and drug program. And go ahead and just say yes or no. So how many folks here in the room have alcohol and drug programs? Okay, Ken, just one, okay. Several out online, so it looks like I'll go ahead. Changing. It's changing as people are changing their minds. Let's see. So I'll share it. So it looks like it's about 2/3 of everyone on the phone have an alcohol and drug program. A little less here in the room, but okay, now I can just hide it. We're still seeing my screen, yep. Right? Okay. Yeah. Sorry, guys. Oh, we're going to talk about 42 C.F.R. a little bit. So for the folks in the room that don't have alcohol and drug programs, just kind of consider it a time to have get a little bit more knowledge. 42 C.F.R. was developed around protecting your alcohol and drug program data, your client's data. The idea was they were afraid that people wouldn't come for care if they were worried that they would be exposed. And even today, I think there's a big stigma about getting help for alcohol and drug services or use and abuse. So this came before, 45 C.F.R., right? This has been around for a while. It's called 42 C.F.R. Part 2. Some people just say Part 2. But those are the federal regulations governing the confidentiality of your drug and alcohol abuse treatment records, even your prevention records, okay? And like I said, it was motivated by the concern that people wouldn't come in for treatment. So who's covered? So it applies to any individual or entity that's federally assisted and provides alcohol or drug treatment services or referral for treatment. So if you have a drug and alcohol program, if you've got a prevention program, if you've got a crisis program dedicated to alcohol and drug use or abuse, that would be covered. There's also this little caveat in there about that part, federally assisted. That means if you get federal dollars into your program. And they mentioned if you have providers on staff that have DEA licenses, they're federally assisted. That's at the federal level. So think about your current programs today. It might not be labeled alcohol, and drug abuse prevention, but if you're treating clients for alcohol and drug abuse issues and you have a doctor with a DEA license, you might look into that. Just take a look and see if that might change any definition at your agency. It's very restrictive. So if we look, and I have a couple slides later about comparing 42 CFR to HIPAA, remember it's the most stringent or the strictest rule that trumps. 42 CFR is very specific about what you can and can't do. So it restricts the disclosure of any of the records. And any record that would identify the patient or the client as an alcohol or drug abuser. It also includes your TPO. So your alcohol and drug clients have to sign a release stating that you can bill with their data, very specific. The consent must be in writing. There was some part of the rule that said you could get a verbal consent from the client, but you absolutely need to follow up and get that in writing, or else you might be exposing that client's data.
Does that also include sharing data with other providers as they look at your overall treatment?
Providers
mental health programs see substance abuse information without a consent in place.
Well, that'd be up to your county council to give you a recommendation on that. I was from Santa Clara County, and our county council was very strict and said no, that drug and alcohol and mental health records have to be kept very separate unless you have a consent signed by the client. And the consents are very specific about who you're sharing it with, the dates, what you're sharing, and it's automatically revoked at the end of that expiration date. So, you have to check, but I'd say no. Don't assume you can. Even if you're a behavioral health organization, you might have your departments talk to each other about that. So I don't know about you, Ken, if you have mental health and alcohol and drug in the same database.
That I don't know if they are actually in the same database, but they do have some drug treatments that they outsource, and then they also treat drug and alcohol at the hospital.
Okay.
So I'm assuming they probably do.
Yeah.
They do have some mix there.
Have to look at it. Have them look at. The code has. I just put the table of contents in the code. There's the introduction, general provisions, disclosures with the patient consent and without the consent. There are certain reasons that you can disclose without a consent, and I gave you the link there to the E.C.F.R. If you in your nighttime reading pleasure. It's published by the U.S. Government Publishing Office. Written consent, like I said, is really required. And we talked a little bit about that. It's very specific, the data that has to be in the consent. I don't have all the data elements noted here, but if you're interested, we can send out a sample 42 CFR consent You just have to make sure that all the data elements are there and your client understands them when they sign. You can't disclose information unless, let's see if I talk a little bit about that. There are reasons why you can disclose client's information without a consent. Yeah, I have a slide and a couple slides to talk about that. They're also required to get a summary of the 42 C.F.R. laws so they understand what regulations you're under. And like I said, it's all around to help them feel more comfortable. So you can have multiple, agencies you're going to share data with on the same consent, but it still has to be very specific. So we talked about exceptions. The rule is there are some exceptions, but always work with your privacy officer or your security compliance officer or your program director. Never feel that you can disclose without a consent on your own. Talking within your program, that's fine. I mean, we have to treat our clients, we have to work collaboratively. Going into another program, no, not allowed. They have these groups called qualified service organizations. I kind of see that similar to what we're talking about as business associates, people that you're working with to do your care. Medical emergencies, response to a crime. Let's say you have an alcohol and drug client that's acting out in the lobby and hurts someone, gets into a fight with someone. You can call the police. And, they're coming to your alcohol and drug program. It is kind of an exposure, but you're allowed. Some research approved by the IRB in your area. And then some other items there, like I mentioned, child abuse, neglect. There's some rules about that might involve minors. Response to a valid court order. It has to be a court order or a subpoena for your records. And if your client, unfortunately, passes away and someone, like the coroner's asking for things or someone needs a cause of death, you can give that. But like I said, always ask for some support to make sure you're under the rules before you do that. Okay. So a little bit, just like we did with CMIA, we wanted to compare 42 C.F.R. to HIPAA, so 45 C.F.R. There is a link in your resources to a comparison table, but bottom line is the comparison table you'll see did the analysis against the two rules. 42 C.F.R. really trumps. It really does. So if your agency has a drug and alcohol program, just make sure you're following the 42 C.F.R. requirements. If you think following HIPAA is enough, then you need to take another look at that. HIPAA does state some things that are required on certain forms that 42 C.F.R. doesn't. So in that case, you have to make sure you have both on the form. Always fun, huh? How many people have dealt with SAMHSA? No? Okay. They're a great organization. Substance Abuse and Mental Health Services Administration. They're at the federal level. But they have a lot of great information on 42 C.F.R. if you want more information about that. And I just put their link there. If you just Google samhsa.com, you'll find it. They're a great resource. Okay, how are we doing? Good. We're doing good. Everybody doing okay?
Yeah, I just want to add on the SAMHSA website you gave. Sometimes they have a lot of free resources. So it is, and actually, it's a nice website.
Mm-hmm. Good point. Mm-hmm. Yeah, anything you can get for free, that helps, right? Okay, I'm going to do another poll here. Let's see. Poll 7. Let me make sure I'm going to read it totally here. our current policies and procedures have been, and then your options are updated since the omnibus rule change in 2013, developed several years ago, haven't really been looked at since, or needs to be updated as they still mention old, I think that's what I'm saying.
Floppy disk.
Thank you, old floppy disk. So the idea is, you know, are you on top of the changes or do you need to look at them? Okay, and it looks like, how about in here? What do you guys say? How about A, updated since 2013? Okay, good. B, developed years ago, might have to look at those. C, really old. Okay. Some people didn't vote. Maybe you're not sure. Okay. I'm going to close it. And so that's good. It looks like most everybody on the phone, 58% of you, feel like you've updated your policies and procedures since 2013. That's great. Okay, close. Close, right? Or share?
Share it.
Okay. Now hide it. Okay, there you guys go. Only 5% said, you know, you might still be mentioning floppy disks. Don't feel bad about that. It happens. That's why we're here today. That's why we're training folks. You know, if you're not compliant, this is your road to get started. Okay. I'm going to move that back so we don't have to look at that. Okay. So we talked about policies and procedures. HIPAA states very specifically what policies, procedures, and plans you need to have in place to be compliant. So this is the list. Oh, good. Everybody can see it here. That's recommended. Talks about acceptable use. That means how your staff are using the network, the internet, the software. Access control. How do you give people access to your network, to your Active Directory, to your software? We talked about business associates, your contingency planning, incident response. I don't have to read them all to everybody. You can just kind of read that on your own. But HIPAA is asking that we have policies that line up with each of these areas. It's nice to have it be separate policies because it's referencing the separate 45 C.F.R. sections that pertain to that rule. And when the auditor comes in, they're going to want to look at your policies, and that's one thing they're going to want to look at. Are you on top of HIPAA enough to know that this policy is related to this part of the regulation? Violations and sanctions, we talked a little bit about that. You need to be very clear with your staff what's expected and what happens if they make a mistake or make a mistake multiple times. Workforce training, you have a policy around how you're training your staff, what you're training your staff on. Any questions on any of these policies that were just listed here? Nothing in the room? Anything out on the web? No. Okay. I stuck a cartoon in. Hopefully you guys can see that. Nancy's taking it very seriously about HIPAA. And sometimes we joke about that too. You know, the law is very strict and very specific, and then we have to do our jobs, right? But if we do our jobs in a way where we're aware, we have policies and procedures, people are trained, we're following the process, you know, you're good. This is a slide of some of the procedures that HIPAA recommends. And it kind of ties to the policies. Some are a little different. Mobile configuration, that's a big one right now. Other device configuration. Wireless configuration. Your vulnerability assessment, you have to do a security risk analysis every year. And part of that, it's recommended you do more of a pen testing kind of a evaluation of your networks and your servers and how secure they are. We'll talk a little bit more about that this afternoon. PHI inventory, we talked about that a little bit. What's your procedure for control over your PHI? And we had mentioned, you know, software or even Excel spreadsheets that have PHI, the devices, getting down into your smartphones too. If you allow folks to get their email on their smartphones, you have to think about that. Encryption. We're going to talk about that pretty well. I don't know how much in detail this afternoon, but we're going to cover it in more detail than today. But encryption is really important because it's considered addressable, and we'll talk about that later this afternoon. But the nice thing is, if a device is encrypted and stolen or lost, you don't have to report it as a breach, because the federal government says if the data can't be used or accessed, you don't have, it's not a breach. So that's like the one, you know, thing to really think about is encrypting all your devices. We talked about plans. So HIPAA is asking you to have these 3 plans at least in place. Your contingency plan, business continuity, disaster recovery, your incident response plan. How are you going to respond to a breach or a security incident? One of your IT people come to you and say, you know, I think we've been hacked. You know, what do you do around that? And a physical security plan. How do you make sure that folks that need to be places are allowed in and folks that don't need to be places are not? How do you control people coming and going from your agency? So, any questions on those, the plans or procedures?
If I may just add, Sherry, just the reason why backup and recovery is so important, and this is oft overlooked, is HIPAA does require the data be available within a very quick period of time. Should you lose a system, if you can't make that available back to your clinical teams so they can provide treatment within, I think it's 3 days, that's considered a HIPAA violation as well. So it's not just losing PHI to the public, it's also not being able to bring it back to the ability to provide treatment. So backup and recovery and disaster recovery are very important topics as we go forward.
Thank you.
We do have a couple of questions.
Okay.
Here. Is there a resource to use to develop these policies?
So the question about resources, there are many resources out there that will help you develop policies and procedures and plans. XPO is one resource. I don't want to do a sales thing, so you know, I don't want to get into that. But you can find agencies out there that help you. Actually, CMS even has a security risk assessment out there online. I don't think they have specific policy procedure templates out there, but there are some resources you can find to help you. That's a great point. You know, if you don't have to start from scratch, don't. Yeah, find something out there that is set up and compliant already that you can just edit for your agency and be done, at least with that piece.
There's another question that I missed earlier. Can you expand on the treatment portion of TPO?
So treatment, part of that allowable disclosures of PHI, treatment is how you're treating your client, right? So healthcare operations kind of talks about you working together in your own agencies to treat the client, but anything you do for treatment is considered, you don't need a disclosure. Now, if you're sharing information with someone else outside the agency, you know, if it's about treatment, you're okay. If it's a crisis kind of a situation, you might be sharing information with police officers, or they might be sharing information with you. That's considered treatment. But, you know, anything else, don't go too far outside. If you have a business associate, you have that agreement together, but if you're both providing treatment to the client, that's really covered. That answer? That good?
You had mentioned, like, if you had a crisis and your an officer is assisting, it's okay to disclose, like, let's say a child has an autistic diagnosis. Well, he's just not being rowdy, just because. Can the officer know that diagnosis? Like, as far as how he needs to approach the situation?
I think that would be fine. Yeah, so if the officers come on because there's an altercation or something's happening, you're covered because they've come on site to attend to a potential violent situation or something.
Mm-hmm.
I think you can fill the officer in on, you might not need to say diagnosis, but you might say, John's overreacting because of his, condition, and so it's best to treat this way, I wouldn't give the officer any health records or anything like that.
Right.
But you are covered if they're responding in the event of an emergency.
And you had also mentioned, as far as, like, if you're reporting to CWS, like a child abuse situation, can you disclose further information without a release as far as if it's going to go to court?
Yeah, I think so. I think if you're reporting child abuse, you can disclose without a release. Yeah. Now, if it goes to court, I think that goes into another realm.
Right.
I can get back to you on that, but I would say that would fall into that legal realm where you need a subpoena or you need some kind of
Right.
a legal action to get records.
There's another comment type question. We only share the diagnosis if it might pose a risk to the officer. Otherwise, we don't share.
Okay.
We consider officer safety paramount. Do others see it differently?
Okay. Do people see that kind of the same way? Share the diagnosis if it helps the officer be safe. Otherwise, don't worry about it. Yeah.
How about if it helps the person be safe? I'm not a clinician. I'm not even in the mental health field, but it seems to me, and I haven't done any research, but to me it's just like, whoa, wait a second. If you've got somebody who's, because of his or her illness, is acting a particular way, and the police officer overreacts. I mean, we've heard about these shootings, right?
Yeah.
And so my first inclination was, is it just the safety of the police officer, or is it also to protect the safety of my patient?
Mm-hmm.
I don't know. Sorry.
Yeah, good point. And I guess if it would make sense, if you think it would help the situation, the officer know this client's schizophrenic or this client's bipolar, would that make them treat them differently? I think it's a great.
I would say it's the safety of the situation.
Yeah.
Exactly. And not just the safety of
It's
the
not an
officer.
individual, it's a situation, which may be more than one person.
These are bystanders.
Yes.
Right.
Mhm.
But it's just telling whoever what they need to know and no more.
Just enough
Minimum.
information is what you can provide within the scope of what you do clinically. So yes, it is allowable.
Good. The minimum necessary, that's the buzzword, right?
Yes.
Mhm. Okay, good.
Just a comment, we share the information to protect the client as well. We make the assumption that the client doesn't want to be harmed.
Well,
Yeah.
sometimes that's true. Okay.
Thank you.
Yeah, no, good question. So we've talked about, policies, procedures, and plans. We're doing all this great work, getting them all defined and all that. Well, we have to then train on those to make sure the staff are following the procedures correctly. And that's sometimes a challenge, but that's our job. So you have to make sure that your staff are given training, even temporary users, if they're accessing your PHI. So let's say you have an intern that comes in and is going to be working at your location for a week, and they're going to be charting and doing things with even paper charts. You have to make sure that they're trained on HIPAA, the privacy rules, security rules, to make sure that they don't come in and breach as well. It covers both hardware and software. So let's think a little bit about our training strategies, and I do have another poll. Here we go, guys. We train staff that hire and annually at our agency on privacy and security regulations. So it's either a yes or no. It's really easy. So how about here in the room? Okay. Everybody's a yes? Great. Wow, look at that. Awesome. Good. All right. In the room we have, if not 100%, real close. So that's great. We are all focused on training our staff on HIPAA privacy and security regulations. Well, 90%. That's pretty good. The 10% or the other folks, I'm sorry. One of the things that HIPAA asks is that you have a training strategy, and you all may have it. This may be easy slides. A training plan, and make sure the materials are all updated as the rules change, and that you have those training materials documented, because the auditor is going to come in and say, great, you're training your people every year on HIPAA, that's awesome. Let's see the curriculum. Let's see what you're training them on. And let's see your logs that prove that all your staff have received that training. Now, my husband's a clinician, and he says it's like one of the worst trainings he ever had to go to. You know, so you're not going to get a lot of excitement. I trust you. I trust you on that. But we have to do it. So make it fun. Make snacks. There's also online training that staff can take, that they can maybe do it at their own pace, that kind of thing. I see a hand raised. Are you seeing that too, or am I just seeing that?
Yeah. That means someone would like us to you to try.
Okay, we're going to try to unmute you. Ian Walsh.
Hello, can you hear me?
We can. Yeah. Hi, Brian.
Wow, I didn't know you were going to unmute me. I asked a question via the questions page, and so I'll just read you that question. And it is, do business associates need to create a separate training by themselves, or should the training be the same between the county or the agencies and then also the business associates? Is there anything about that?
Okay, good question. So your business associate is responsible to do training just like you are. You can have them come join your training if that works for you and you want to do that, or you're trusting that they're training their staff just as you're training your staff. And you have the right to go in and audit them. In fact, you should be doing that. And you can ask for those same logs. Let me make sure your staff have been trained. Let's see those. It should be the same content, though, as well.
Okay, so it would be a good idea for the content to be the same regardless of who's providing that training.
Yeah, I would think so. Some of the things like your business associates might not need a notice of privacy practice because they don't deal directly with the client. Some might, but some of your more technical business associates, you could leave that part out. But the majority of all the regulations apply to the business associates too. Okay,
so if the county isn't providing that service to the business associate, then they just need to verify that the business associate is doing that service themselves.
Correct.
Okay, and then both of those trainings should match up.
Yes.
Okay, thank you. That was perfect.
Thank you, Brian.
All right.
Covered entity is allowed to interpret and make rules stricter, and how you set up your particular policies or procedures might be specific, so you would want to make sure your business associates understand that so they can properly educate their teams. So that would be one example of why you want to drive it down, but the business associate would have to provide that to their people.
Good. Good. Any other questions on training? One thing I wondered is, people said 90% have training. The new regulations state you have to train on hire, you have to train annually, and then you also have to have these things called supplemental, or It could be trainings, it could be mentioning HIPAA in your staff meetings, it could be a screensaver that comes up and says a little tip and trick about HIPAA. So keep that in the back of your mind too, because 90% or 95% of us are in compliance, and that's great. You know, refer to the training rules just to make sure that what you're doing today is compliant. I don't think they'd ding you too much if you didn't have those subsequent reminders or trainings happening, but it is part of the rule now. So good. We're moving along here. So part of next steps that we want to talk about are how your agency can get to the compliance. It's great you're all here today. You're learning about HIPAA. This could be considered your annual training, especially if you pass the exam. But what you need to do, and this might be redundant at your site, you may already have this, but go back and look at if you have your HIPAA compliance team established, and to make sure that all those security roles are covered. I can send you, we can also post, we've got a draft policy of security roles and the responsibilities that I said today. It's kind of outlined in the policy, and if that would be helpful, I can post that out too. Okay, so I'll give you that document as well. And what it'll do is it'll show you all their responsibilities. Remember we said you don't have to have 6 different people. If you have a really small agency and there's maybe 4 people, that's fine, 2 people. But you have to assign them to one of the roles or each of the roles, and they need to understand their responsibilities. I advise that you review the current P&Ps against those 45 CFR, the sections. I noted the sections here. If you find someone to help you with this, they can help you. Because most agencies that do risk analysis or the security risk assessments for folks have templates that you can start with. But you want to look at these parts of CFR and make sure your policies and procedures match up. Big thing is making sure you have control of your PHI. We talked about that. That'll be an audit question. Biggest challenge for me when I was working in IT was, like I said, the one-off Excel spreadsheets or the access databases or maybe even paper logs that people keep. You have to know where all that is. And a lot of times, you know, people just do their job. Everybody's just trying to do the best they can to get their job done. But you just need to know, as a part of your compliance team, who's doing what, right? Not to necessarily change it, but you need to know about it. Or you might be able to do a workflow improvement and say, you know, instead of doing this, how about you do this? How about you save it out to this secure network drive? And then that takes a big, you know, possible risk off your shoulders because the network drive is secure, and if it is.
Harry? There's a question. Is there a description of each of the roles somewhere?
Yeah, so what I'll do is I'll put that sample security role policy out with the other documents, and in that you'll see the description, their responsibilities. It's what I said today, but I might have gone kind of fast, you know.
And another one, is it enough to know that my ePHI is located on specific share drives and my document folders on the server? We don't all store ePHI on a local hard drive.
So in that case, they're in good shape, right? There's less you have to inventory. I just say, yeah, that's great. Just confirm that. If maybe people are not allowed to save to their C drive or their local drive, that's even better. But, you know, if that's your policy and procedure, that's good. One thing we were looking at too, actually, at another customer site was there might be shared drives out online or available to folks. Some might be more secure than others. And so it might just be a habit somebody's gotten into to save their PHI to a folder that's public, you know, just because that's what they did. That's what they always did. Or maybe they did that before the secure drives were developed. you know. Taking inventory of that is a great thing, because then you can say, hey, now instead of saving to this public drive, let's go here to this secure drive, and we'll give you access as well as a couple other people, and, you know, then you protect who sees that data. The whole idea is this thing called creating a culture of compliance. And they mention that in the HIPAA regulations too. So the point is, we're all in it together. It's not just an IT job. And I don't know, I guess we could talk about that later this afternoon, but if the IT departments are kind of getting hit with, this is your job, then go home and say, no, it's not. It's partly mine, but we have to work together to create this culture. Okay, just a couple other next steps here that we recommend. We talked about business continuity, physical security, and incident response plans. Just make sure you have something in, you know, that you have documented and that you have tested. Like Randy was saying, there's rules related to, you know, especially if you go into a full EHR environment, everybody is electronic when they're treating their client. So rules around how long can the system be down before you go to your downtime procedures. And then, do you expect all that data to be re-entered when the system comes back up, kind of a thing. What's your backup plan for prescribing medications, for getting lab orders in, if you have all that in your EHR as part of an interface? Important thing is to test it. I always recommended a full test where you bring a server down and recover from one of your backups annually. That's everyone understanding it's a test and being involved in that. And we always had a couple tabletop tests just to sit around like we're doing right here, and we say, okay, server, you know, 145 is down, and that has Avatar, that has Concentrix, that has whatever your EHR is. What do we do? And everybody at the table has their roles, and they know what they're supposed to be doing to get it back up. How do you communicate that out to everyone? You know, what's your process to get the word out that there's a problem, who's working on it, and when it's resolved? Like I said, physical security is more about making sure. I think a lot of folks are paying attention to that now. You know, we have the receptionist up front here that takes down your name, you know, when you're here on site. That's great, because the thing is, we can walk back here and we might see somebody's name or something on the desk. We need to know who's here. Or maybe not. You know, maybe they're all protected here, but still, you're in an environment where you might have access. Part of the requirement is you have your annual security risk assessment. We're going to talk more about that later today in our technical class. But if you haven't started those or you need some help with those, reach out. You can always, you know, ask me, Shoshana. We can give you some resources if you need some help. Any questions on that, kind of the follow-up, the takeaways from the course this morning? No? Anything on the web? Okay. Okay, so we mentioned audits. You know, just because we're doing all this for our clients, we're also doing it because we have a chance of getting audited. And so what might happen is you'll get a letter, somebody will get a letter from the Office of the Inspector General, who's also now in charge of these audits. And they might say, we understand, you know, you're a covered entity, and we want to come on site and audit your HIPAA compliance program. I found some information online. I had a great article that said, what is an audit like? Right? So after you get the letter, they come on site, and they expect them to stay 1 to 2 weeks, is what the article said. And they're going to just decide to look at every part of your HIPAA compliance program. Everything we talked about today will be fair game. And so the idea is the more prepared you can be, the better. Part of that security risk analysis is a gap analysis, right? You're going to look at different things, your current processes at your agency, and you're going to say, yep, I can do this, or no, I have a problem with this, or we sort of do this, but we need more effort. That's going to create a gap analysis for you, and it's going to show you where you need to be working. You know, you're compliant here, but you need to focus here to mitigate some of your risks. That is very important because if the auditor comes in, they're going to want to know, where's your gap analysis? And if you've done that, you can say, here it is. We're working on these things. We have this completed. This is still in process. They like that. And they especially like that if the dates aren't old. If you've got your plan in place and, you know, you're going to be patching your antivirus next week, or you're looking at your new encryption process, you've just, you know, contracted with an encryption vendor, you're getting all your devices done, and that should be done by next month, you're looking good. They're not coming in today and saying it all has to be done. Not yet. But they want to know that you're aware of it and you're working toward the process. Some of the things they're going to look at, I mentioned your security and your risk assessment, your security plan, your org chart. They want to know that you understand who's in your agency, your network diagram, any portals you might have available for your clients to go in and access their data, secure email, the provider, that kind of thing. The policies and procedures. They want to see how you're scanning your network and your servers for any kind of security risk. Part of that, too, we'll talk more about that later today, are who's monitoring those logs and making sure that if there's anything that looks suspicious, it's being addressed or looked at. How your users access, and then your business associate agreement. So all the things we talked about today are covered here as part of this audit process. So important to go back, look at those next steps, kind of get yourself, and even if you're one of those 90% that feel real confident about your training, and I think it was a little less for folks feeling their HIPAA compliance maybe was as complete, go through the list. And if you're great, if everything checks out, you're good to go. And focus on the things that you need to work on. Well, I must have just talked really fast, or we didn't have a lot of questions. But that's the last slide. I wanted to talk about taking your exam. But any questions about content or anything we talked about today, next steps? No? Okay. So we'll get this out to folks who don't have laptops. People online, you're all at your computers. So what everybody can do, and we can take the time now, the remaining time in the class, to do the exam. Mm-hmm. The benefit there is we're here. If you have a question about something and you're not sure and you want to talk about it, you know, we won't tell you the answer, but we'll talk about it. We can do that. For those that don't have your laptops, I'd say just try to go take the exam soon, sooner than later, while it's fresh in your mind. You will have the PowerPoint next week, so you can have that before you take your exam. We didn't put any cutoff on the exam. This is pretty wide open for these classes this week, so if you need to take it a couple weeks out, that's still going to be okay. It'll still be open for you. It's going to ask you to log in and get a user account here. So you go to, actually, let me make sure. I want to say it's xpiohealth.cibhs.org. Let me.
You should be able to click on it to go to that.
For those who don't have laptops, could we print out the test?
No, it's really not set up that way. Let's see. way, let me get it for you. I don't want to give you wrong information. So what you're going to do is you're going to click on courses. You're going to, actually, let me give you the right one. You don't have to go through this. We eliminated some of the steps you're going to have to take. And I don't want you to get stuck in something that, okay. Thank you, Kelly. I can just go there. That's cute. Okay. It is xpiohealth.org/CIBHS. Ha! See, you don't have to go through all that other rigmarole. And I'll make sure this is updated in the, I'll have to update it in the slide.
We'll send the link to.
Yeah. So, this is the one we just took, HIPAA for Executive Leadership. You're going to click on that button, and it's going to ask you to check out. And this is where you're going to register and get a login. Okay? Not asking for a lot of information, but just so we can track who you are when you're taking the test. Anybody have questions online that are trying to do this now?
Just one person has corrected you and says it's not backslash, forward slash.
Thank you. You're right. So go ahead. Dawn, are you going to do it?
Yeah.
Okay, cool. Let me know if you have any trouble. The rest of the folks who don't want to do it right now, you're welcome to be with us, or you can leave a little early. And so, do we have lunch coming in, or are people on their own?
Nope, we have lunch coming in probably in the next 10 minutes.
Okay.
So why don't we go ahead and we'll pause the webinar so everyone can take an hour break, and then we'll get back on.
Okay, I kind of wanted to see if anybody had trouble logging in.
Oh, sure.
Is that okay?
Oh,
okay.
absolutely.
Yeah. Because I've got my guy on call if we need it.
Can we stop recording it now and then start recording it?
Are you?
I'm recording.
Yeah.
Thank you all for being here. It's been great. There will be a survey about an evaluation coming out somewhere online maybe. Please take that. Let us know what we can do to make things better right, good afternoon, everyone. Hope everyone had a great lunch break. We're back for our HIPAA technical training for this afternoon. So we just want to make sure everyone got through the HIPAA overview this morning, because some of the definitions and things we talked about this morning will be assumed that you know this afternoon. I will introduce myself, just in case we have some additional people. So my name is Sherry Silvera Moliere with XPO. Prior work at a clinician, and then moved to a large county here in California, Santa Clara. I went to a software vendor from there and started with XPO about a little over a year ago. So Randy Wills is here with me, and we're going to be going through the technical class. This focus will be mainly on the security rule and the parts of that are technical. It's not deep dive into a lot of technical aspects, but at the end, if we have any follow-up questions, we can always get back to you on those. The agenda's up on the screen there. So we're going to be looking at the security rule, responsibilities for IT managers. We're going to talk about encryption. We're going to talk about safe harbor that covers both part of an encryption focus as well as the identification of data. We're going to talk about computer and laptop security and some compliance strategies at the end. I do have the references there at the bottom. Let me just scroll down a little bit. Resources. We'll put the files out on the website for you to access, just like we did this morning. We will do. And then the links are all here for you, too. So when I talk about different websites or things like that during the class, I've included the links here for you. All right. So let's get going here. Start the show. Okay, as this morning we want to mention that the information is current as of today. So just remember that. If you take the data, take the PowerPoints and print them out and refer to them in a couple years, some of it might be outdated. So it's important to keep current on those things. We're going to be working through the slide deck today. Like I said, the resources have been included. And be sure to take your exam. There's an exam on this one, too. Same process. We've done some changes to the LMS, it's called, the Learning Management System, of course, last night. So that, was a little clunky this morning. So hopefully it'll be a little smoother this afternoon. But send me your feedback if you have issues when you take your exam. Okay. We already talked a little bit about what we're going to talk about here, so that's good. I wanted to do a poll, my first poll for this class. Let's see. Your IT department has an IT security manager identified and current with all HIPAA rules. So that's the question. And your responses, your options are yes, we are ready. B, we have an IT manager to handle, but not ID'd any security roles. And C, we've not initiated that yet. How about in the room? How many A's do we have? Yeah, John's on top of it, okay. B, okay, mostly B's here. And then C's. Any haven't initiated? Some are coming in on the web here. So it looks like 55% so far feel like you're ready. So that's awesome. 33% IT manager to handle it, but not identified necessarily your security roles. 13% haven't initiated it yet. Okay. Good. I'm going to close that poll, and then we can share the results there. Okay. So the folks that feel like you have initiated it, definitely, let me know, like we were talking at break about some mobile device configuration or some security that one of our folks here in the room has, definitely feel free to, say something or participate if you have a great gem you want to share with the group. Okay. I'll get rid of that. So we talked a little bit about breaches this morning, but why security is so important is it's going to protect our PHI, right? Everything around the electronic side of the house. Just a little history on breaches. They're saying now that half of them are from healthcare. They pretty much are saying that healthcare data is one of the most valuable sources of identity theft, as well as people, stealing your identity to get healthcare services, people that don't have insurance. And it's a wealth of information in there, right? Because you've got your payer information, your Social Security, a lot of identifying information is there. One of the resources I found said that healthcare data hacks have increased more than 100% in the last 6 years, or probably more like 5 years. So it's something we have to be concerned about. Part of HIPAA Security Rule is that you have to conduct a security risk analysis. And that's a lot of what we've been talking today is part of that security risk analysis. You have to document, as we talked this morning, document your PMPs. You have to document all your plans around that. 45 C.F.R. is where we are going to look at for our security rules. So we talked a little bit this morning about what became effective in 2005, the parts of 45 C.F.R. that really focused on security, the difference between privacy and security. We talked a little bit about that. Privacy covers all forms of PHI, the written, the oral, the electronic. Security pretty much covers the PHI, right? Privacy rule is mandated requirements that have covered entities as well as business associates adopt those regulations. The security rule expanded those regulations. So it started with privacy and then thought, now that we're going into more electronic world, we better focus on security. The rule covers confidentiality, integrity, and availability. Sometimes you might hear that as CIA as you work through your security process. The rule's made up of 3 safeguard groups called administrative, physical, and technical. And then each of those groups are divided up with those safeguards mentioned. They call them required or addressable. And as we go through the list, you'll see HIPAA's basically saying, the regulation saying, these things you're required to do. You have to have those in place as part of your security compliance. Some are identified as addressable. And it doesn't mean that it's optional, but it means that there's certain rules behind those. If you can't meet that standard, if there's something that impedes you at your agency, there's some reason why you need to do a different thing to meet that same kind of standard, they kind of give you that flexibility. About 50% of those rules are administrative, and we're going to talk about that. They're all kind of focusing on the technical measures. And again, we hear our word, the culture of compliance. So everything we're doing, privacy, and now we're talking about security in more detail, is all about making sure everything's up to date so you can say you're compliant. That's all I wanted to say on that one. We talked a little bit about that the HIPAA regs are somewhat flexible and that they really want them to be scalable. So they want every agency, regardless of your size, to adhere to the regulations. And because of that, they say, single provider office all the way to a large hospital system, everybody has to address those regulations and comply. Some of the flexibility I talked about was, around kind of that the addressable standards that we'll look at. Other things are if it's out of your budgetary control. Let's say you really need to encrypt all your devices, but it's going to cost more than you have budgeted this year. What can you do? How can you phase that in and work, to get everything encrypted maybe over 2 years or 3 years and prioritize what's important? They're open to that kind of flexibility, with the understanding, though, that you have to get there. Does that make sense? Any questions about what we've covered so far? Kind of just been doing an overview, but no? Okay. So, the first and most important requirement of the security rule is your security risk analysis. And it's pretty detailed. They know exactly how to define that, and they want you to understand that too. It includes everything to help you identify potential risks, and also determining the probability that those risks will occur. It's broken up into a couple parts. The first part is the risk assessment that includes a detailed list of questions, and it's really based on the NIST or NIST guidelines around technology standards. And then that's something, we've talked a little bit about it today, where we ask questions about your current situation. And that's anything from your privacy rules, your security rules, how your policies and procedures look. I mean, it's pretty detailed. And from that, then the gap analysis is created. Where do you have some gaps? And that talks about the policies and procedures and a lot of what we talked about this morning. There's also the second piece of it, your IT infrastructure assessment, or your penetration testing, where you usually hire an outside vendor to come in and do that testing for you. It includes looking at your network, your desktops, your servers, and where someone can get in and possibly access something that they really shouldn't be. I had a story of one of the pen testings that we did, because XPO does that as well. They got in and accessed cameras in the executive director's office. And so they were showing the executive director sitting at their desk. And that was just, open exposure. But it made a really good point, right? We need to make sure we lock this down. I didn't hear what the person was doing at their desk.
Working.
It's working.
But just the fact of being seen was scary enough.
Working hard.
Yeah.
I found this interesting. I put the link out to this top 10 myths of security risk analysis, and I thought it was good to talk about them a little bit. Some people have their mind set on what that might be, and it might be accurate, but there are some myths out there that I wanted people to kind of take a look at. Top one, the security risk analysis is optional for small providers. And you might say, yeah, it's too expensive for me, I can't do it. No, you have to do it. Everybody has to do the security risk analysis. Simply installing a certified EHR fulfills the SRA. No. Sorry, no. It's a great start and a good start towards getting maybe some meaningful use dollars in, but no. My EHR vendor took care of everything. And a lot of vendors might want to tell you that. We're making sure your infrastructure is secure, blah, blah, blah. No, you're responsible. And it's not just your EHR, right? We talked about this morning. You have to document where all your PHI lives. I have to outsource the SRA. Now, that's a myth. So we talked earlier today about resources that might be available to help you or have some templates for things. There are things out there. But what they say behind the myth is, you know, you don't have to, but you have to make sure you're following a standard process that's verifiable, that you can prove, you know, your compliance if an auditor comes in. And a lot of agencies just find it so much easier to just say, I'm going to trust the experts to come in and do that for me. I'll work with them, but let them handle it. A checklist will suffice for the SRA. And that might be part of it, but not the whole thing, unfortunately. And there's a specific method I must follow. That's not really true. You can do it how you need to do it, but the goal is to have a complete security risk analysis that hits all those levels and addresses everything that you need. I only need to do an SRA once. So what we talked about this morning is this is an annual process. Besides having to do the risk analysis every year, you're going to have to keep yourself monitoring and with this ongoing security compliance team, making sure that things don't fall through the cracks during the year, right? After the first time you do it, the first time is a little laborious for sure. It takes some time. And you know, what I keep hearing from people we work with is, I have so much on my plate, I can't fit this in. You know, it's true. There's a lot going on today. But if we dedicate some time to just knock it out and get it done, then the next year rolls around, you just have to review. Did anything change this year? Do we have to update anything? If not, you're done. Before I test for an EHR incentive program, I must fully mitigate all risks. So that's a myth, and that's a little overwhelming, right? Because how can you make sure everything's done? And so I think we talked about that this morning. The auditors will come in, and if you've got a good gap analysis and a work plan, and you're working toward completing your task, and you're in a good, you know, your time frame is good, you haven't, you know, let things go for years, or things were due months ago that you haven't attended to, they're going to think you're moving along, and they're going to appreciate that, not ding you. If it goes too long, or they find a timeline that's way expired and nobody's doing anything, then yeah. And each year I have to completely redo my SRA. Well, that's what we were just talking about. You don't have to completely redo it. What's really nice is you have to refresh it. And the idea is you're monitoring it throughout the year. So you're on top of it. You know what's going on. You don't have to start from scratch. So, some general ideas about the security risk analysis. A couple links there. I've got the risk analysis information as well as the myths here you can take a look at. Sure, okay, good.
Do you have a sample of the risk assessment questions available to share?
Well, we have something that we use.
Or where to review a sample of the questions?
There's several tools we should post where those are. There's some freeware samples out there. I believe CMS has one on their site. But then there's other professional tools, if you will, that include additional content and templates and samples. So it depends what you're looking for. But we could make some information available on what some of these options are.
Okay, that's a good idea.
Okay.
And then there's two questions about how do you define a small provider?
Well, in my mind, I define a small provider as maybe a single EP office, a single doctor office, maybe an office that has a group of therapists, less than 10, that kind of thing. It's all relative. You know, it's just the idea is regardless of your size, you have to protect and you have to do the security risk analysis. Is that good?
How about vendors that you can outsource to? List of vendors?
Would you like some resources there? Okay, great. So I guess everybody can hear the questions, so I don't have to repeat these.
One more.
Oh, one more, okay.
Would anyone be willing to share their SRA questions that were used in format or the analysis.
Has anyone had a security risk analysis yet?
We do risk, but nothing specific to the EHR or the security rule.
Okay.
That'll be new for us.
Okay.
Again, we'll post it. I think the CMS tool would be a great start for people to reference.
Mm-hmm.
I don't happen to recall the link off the top of my head.
We can give it to you. I'm not sure I put the CMS resource in the list, but we can give it to you. Is that it? Did anyone online want to share their SRA or questions? No?
Yes.
Okay. All right. So remember we talked about the safeguards, the 3 categories in the security risk analysis. So administrative, it really establishes the foundation for the program. Now, what did I say? How many? What's the percentage of these that are in the administrative? Does anybody remember? It's like over 50%. So this is a real big focus for HIPAA. They want the administrative safeguards really focused on. So what's included, and we can just go through some of the list here. Security management process, and I tried to bullet and then the specifics underneath those. So included in there are risk analysis, risk management, policy, and information system activity review. See the little R next to it? That means those are all required. You have to do that as part of your security. The sanction policy, if you remember from this morning, that's about workforce sanctions, violations and sanctions. That's all I need to say about that. Assigned security responsibility, that's also required, and that relates to our security roles, and that you have designated people, person at your agency that's responsible. Remote security access, work where you're going to talk about your authorization and or supervision, your workforce clearance procedures, and your termination procedures. Now notice the difference there. These are now we're getting into the first A's, or addressable. So we remember what we said. Those aren't necessarily required, but it doesn't mean they're optional. So there's rules about how you as an agency have to address these. You have to either say why you can't comply with the rule as it's written, or you have to then say what you're going to do to mitigate that. Might not be exactly what HIPAA is asking, but you can do this, and it will take care of your risk. Termination procedures, that's around things like when staff leaves, how do you tell IS or someone to disable their account? And that's their account into the network as well as into your EHR or your other software that has PHI. Probably a multi-departmental task, right? Because the supervisor, the person knows they're leaving. There might be a form you have somebody complete. It probably goes to HR. HR tells IS, whatever your current procedures are, the thing about it is you really shouldn't have too much time left. And we've worked with customers who, actually say weeks or months can go by. And that's one of those workflow process improvements that would come up during your gap analysis that you would then address. Information access management. This is kind of around how you give access to folks, that role-based access, where, if I come into an agency and I'm hired in as a clinician in the mental health program working on Main Street, do I have permission to see anything else other than my clients at Main Street? Can I see other mental health clients across the board at all programs? What's minimum necessary that we all can do our jobs and help our clients. You really have to think that way. You don't want to, narrow things too tight. But if there's an issue with some kind of security in a program, maybe everybody doesn't have access to those clients that are admitted to that program. So those are the kind of things around access authorization and how you modify that. That's also included. There's more. Remember we said administrative is the big. Over 50% is in the administrative safeguard group. Hint, hint. Security awareness and training. So under that, excuse me, and you have some more addressable here. Security reminders, protection from malicious software, login monitoring, password management. Those are all things that are defined in the security rules. It's up to you to figure out, if it's addressable, how are you going to make sure you comply within those standards that works for your agency. I had somebody argue with me about the fact that we recommend 8-character passwords with upper lowercase numbers and special characters. And so they went out and they were finding everywhere on the internet where they could prove or disprove me. They don't have to do that. And so in reality, it's an addressable, But if you go to industry standards, that's the best way to do it, right? You can't have your name and a date or something like that. You shouldn't. So this is where we kind of get a little flexibility, but know that we have to comply. Security incident procedures. So this is where we're talking about your incident response plan, how you address any incidents that occur, how you're quick to, identify those and then respond to those, and your breach notification process. Evaluation. Evaluation is around evaluating the whole process that's required, and your business associate agreements. Those are required. We talked a lot about those this morning too. Now those BA have to meet the same standards, and we mentioned it in an answer to a question that somebody had earlier. As a covered entity, you have a contract with someone. You consider your business associate. You have the obligation to audit them. They're responsible, but you need to make sure that they are doing what they say they're doing. And it's not uncommon every year when you do your own security risk analysis, you go out and make sure your business associates are following their rules. And you can ask for proof. Contingency plan. We talked a little bit about that one this morning. It's about your data backup, the disaster recovery plan, how are you going to operate in the event of an emergency, how often you test it, the verification that the testing is successful, and what applications and data critical applications are prioritized. So when you go in and do your disaster recovery plan, for those of you that have done it in the room or online today, one of the first things you do is you list all your software and you prioritize. What's number one? If we have a major disaster, earthquake, I guess, here in California, and everything goes down, what do we put up and in what order? And that's where you identify your data criticality, right? I didn't do a poll, but how many people have done disaster recovery planning or testing? Dawn, okay. Ken? Sorry, you guys, I guess you could raise your hands, huh? But I didn't do a poll, I'm sorry. But it's a really good thing. If you haven't done it, think about it. And I put a link here to a great information from the Cornell Law University about administrative safeguards, and they go through all the requirements for your review, and that link is in your resources. Any questions?
There are a couple of hands up. Not sure. Michael Conti?
Yes.
Do you have a question?
Oh, no, you were raising your hands in the group, and so I raised my hand.
Oh, got it.
All right, Michael, good job.
Look at me using the technology.
Sorry to bother you.
Oh, no, that's okay. At least you know I'm listening.
That's good, yeah. Okay, administrative safeguards, that's one. Yeah, do we need to do a stretch? Is this a good stretch time? After lunch, everybody's kind of, you know, the food's kicking in. The sugar's kicking in.
Turkey sandwich.
The L-tryptophan, huh? Yeah, go ahead, stand up if you want. Just do a quick stretch. Get your body moving. Get that blood circulating.
On the webinar, too.
On the webinar, too, yeah. Good.
It's a lot of information.
It is a lot of information, I know. Okay, so we talked about the safeguards, the three groups. Physical is your second group. And the whole idea here, I mean, in a nutshell, is to protect systems and buildings, right? I also put a link there to the Cornell Law Group document for physical safeguards as well. So, one of the things here, maybe want to do a poll on this one. Let's see if I can get that going here. Our physical security is, and your options are, very secure, all access points protected, and, I can't read it all, and you're together on everything. We have a front desk receptionist that tracks those who come in and out. I wish I could see them all. Do you have that?
Hit launch.
Hit launch?
Yeah.
Oh, okay. Will that show it all?
Yeah, it'll show it on.
I tried to get creative on these. Visitors sign in and find the person they're visiting, something like that. So, go ahead and pick. How about in the room?
We do all three.
We do. Okay, good. So even in your agency itself, can everyone access the server room? Okay. Don's shaking his head. People out in the field are probably shaking your heads too, huh? Okay, so nobody's picking visitors sign in and find the person. That's good. So that means people are really looking at physical security. That might kind of be the first thing we all started looking at, huh? Maybe it's the nature of our business, I'm not sure, but we want to make sure our agency is secure, and that's great. So it looks like a little bit more people are in the A category, share. 44% are in the middle category. Great. Not everybody voted, so I want to make sure everybody does our polls. Okay, is that it? That's all I have to do, right? Okay. Okay, so you're pretty up on this, so we won't maybe worry too much about it, but I want to show you what's in the regulation. Facility access control. So that's about your contingency operations, your facility security plan, access control and validation procedures, and your maintenance records. How do you maintain all the proof that that's working properly? Those are all addressable. So that means you can look at that and determine what would work for your agency if you can't meet that specific regulation. Workstation use. That's about implementing policies and procedures to specify proper use of and access to workstations and electronic media. You also must have in place policies and procedures regarding transfer, removal, disposal, and reuse of electronic media. or your laptops or your desktops, kind of a thing. And your data backup and storage. So this is why I leave the agency and IT comes and grabs my computer and takes it over to Randy, because he just was hired and he's going to use my device now. Is there any process in the middle or procedure in the middle, cleaning my device, making sure everything that I might have had is gone, all my PHI is cleaned off before Randy assumes responsibility for that device, that kind of thing. And you all probably know all that. Any questions on physical? No?
What are the requirements for data media transfer?
Data media transfer. So when I'm moving, let's see if I have those specifically written here. So in the
backup tapes, etc.
Oh, okay. So actually, you know, backup tapes or your backup, you probably save it off-site in a secure location. Should always be saved outside your facility. I mean, best case scenario is you have a redundant server located somewhere else that you can access and go live with in the event that your facility is down. That's kind of pricey. So you should at least have those data saved off in a secure spot. Some people do it at Iron Mountain, other people do it in the bank, the safety deposit box, you know, whatever that is for your process.
Any vendor doing that is right away a business associate, so they'll have to have that agreement and their protocols in place, and then you just need to be able to document and log the process for when you send it, and make sure all the protections are in there every step of the way during the transport if you're moving physical media.
Yeah, good point, Randy.
On the technical, it's just using encrypted channels for moving the data.
She's saying requirements for the actual physical transfer. That's what she's looking for.
Well, I think like Randy's saying, it needs to be secure. So if it's actually a physical tape or hard drive that you're moving from one place to another, you need to have that be in a secure transport mode. We can follow up and get more details.
Yeah, let's take that one offline and get some more detail later.
Yeah.
Okay.
Iron Mountain comes to us with a lockbox,
Yeah.
and then we place the, with IT, places the hard drive in the lockbox and locks it with our key, and they take it off-site into their secured environment. And it's a weekly cycle.
Good. Okay. Third category of safeguards, right? Technical safeguards. And that's around your PNP to protect your ePHI, access control, user ID, unique user ID, emergency access procedures, those are both required. Automatic log off and encryption and decryption are addressable. A covered entity must implement technical policies and procedures that allow only authorized persons to access electronic PHI. The audit controls is a lot around making sure that you have logs that are activated where your IT shop can confirm who's logging in, where are they going, and making sure that they are locked down to the minimum necessary. Let's see here. Integrity controls. Oh, audit controls are required. Integrity is addressable. And that's around policies and procedures that your ePHI is not improperly disposed of. Kind of like what we were just talking about in terms of how long do you keep those data, and when you've exceeded that timeline, and if anybody gets rid of the electronic data, well, how do you do that? Transmission security. Oh, wait, person or entity authentication. That's all around how are you sure that that person who has a login is the right person to get in there. And then transmission security, integrity controls, and encryption again. They're down under there. That's kind of around your network and how are you sure that your network is secure. Any questions about that? No?
She also wants to know, is the lockbox required?
It should be secure. So that's Iron Mountain's solution to that. And tell her we'll get some more information and send that out. What we're going to do, by the way, everybody, is we're going to take all the questions that are being asked from both classes and answer those on paper as well and send them out so you have that documentation. I think that's a great thing to do. So IT folks now, these safeguards are areas that you all need to really focus on. This is your job as part of that security rule. We're going to move on now to business associates. We call them BAs, and you have to have that business associate agreement, or BAA, in their contract. We've mentioned it several times today. It's really important. And why it's important is I think we looked at some slide that talked about business associates. Maybe I didn't include it in this class. We're responsible for like 90% of all breaches before 2013. I mean, they were just like out of control because they didn't have any standards to follow, right? So that's when the omnibus rule came in 2013 and said, sorry, besides many other things, business associates, you're going to follow the same rules as covered entities now. You're just as responsible because you're handling your client, your covered entities PHI. So what we talked about is making a list of some of your current contracts. Some other examples, we mentioned some this morning, server support, your network support. Maybe you do decide to contract with a vendor to come in and do your security risk analysis. They should be a BAA. They might have access to your PHI. We talk about copy or fax machines because a lot of those today have hard drives that you save data to. And so if you have something in your copy or contract that says anytime they come in, they'll switch out the hard drive and give you the hard drive, put a new one in, and then take the device off-site, that's fine. But if you don't have that in your contract, you need to consider a BAA because if they go in to service it and access the hard drive, they have access to your PHI. Okay? Same with fax machines. Take a look at those. So what's included in a BAA? I have an example, and I'm also going to put the template out with the documents on the website for you to review. In 2013, the rules changed, the language changed. So what you want to do is take that template and compare it to your current contract and make sure that it's up to date. If you've done your contracts prior to 2013, or maybe your contracts person didn't quite get it updated like they should have, you might have old language, and you want to make sure you've got the new language. This is just the beginning of one of the templates, the Business Associate Agreement template. I didn't want to bore you with the whole thing. I think it's like maybe 8 or 9 pages. But what it's going to talk about is, as a business associate, this contract is giving them permission or the authority to do whatever they're contracted with you to do. Right? That's it. Sorry. I didn't turn off the speaker, did I? It's very specific, and they have to follow rules about notifications to the covered entity, what data is transferred between the two, how they protect that data, how they dispose of that data. Same rules. Just as a side note, too, there's another, it's called the sub-BAA, So if you contract with someone that you consider your business associate, and they in turn contract with someone else to do some of the job, it's called a sub-BAA, and there's a little bit of a different language. So, you know, you might look for an example of that, or we have an example of that if you need. But basically, it's the chain of responsibility that has to be there. Any questions about that? Okay, we're going to do another poll. Everybody wake up out there. Let's see. Maybe this is the last one. This is the last time I'm going to stop bugging you. Our current encryption status is all servers and devices that have PHI are encrypted. I'm sorry, I can't read the whole thing. I might not be totally accurate. Starting with mobile devices, then we prioritize down the road. And third option, we haven't started. The cost is prohibitive. So how about in the room? Does anybody know?
They were B.
You're B? Okay.
Yeah,
Okay. So you started with the mobile devices as your highest risk, and then you're moving around to what? Desktops and laptops, or laptops, desktops, and servers kind of a thing?
Ours are probably reversed. Our desktops and our laptops are all encrypted, and it's the mobile devices that we need to look at next.
Oh, okay.
Yeah.
Well, you would consider your laptops mobile devices also.
I would, but I would consider this as more, yeah.
It could be portable.
Sorry, I'm probably using the wrong language.
That's okay.
Yeah, my laptops are encrypted.
Okay. How about, you guys were discussing it. What do you think?
We're in the same,
Yeah.
the laptops and that kind of stuff is all done, but the phones and that, we haven't.
Okay. All right. Mako, do you know?
I just want to see the phones down.
Okay. Okay. So it looks like the room maybe is kind of similar to what's coming out online. Looks like most people are kind of in that middle bucket where you started with your mobile devices and then you're working your way down. 39% feel like everything is done, servers, desktops, laptops, and phones. And 9% haven't started. So let's see here. We'll hide that. What I want to say about encryption is it's like your get out of jail free card. It really is. And we mentioned it a little earlier. But you don't have to report a breach if the device is stolen that's encrypted. And the feds are pretty sure about this. It's funny they didn't make it a requirement in the safeguard list. It's addressable, but probably due to the cost and how smaller agencies handle it. But the idea is you have to say what you're going to do instead to protect the data. So it's important for those of you that are in the middle rung or the 9% at the end, move encryption up your priority list this year and get some money in your budget. And I know that's probably like pulling teeth, but it's going to save you a lot of headache at the end, especially if you have clinicians with laptops or mobile devices that are going out doing case management services, meeting folks at Starbucks, you know, I mean, whatever the process is, you risk to have those devices lost or stolen. And I don't know about up here, but down where I'm from in San Jose, there's, you know, people are stealing out of cars. And it's really interesting. They're breaking into the trunks now because they figure, you know, you put stuff in the trunk. So it's like, you know, you have to keep it with you, you know, like an FBI agent or something, I don't know. But you have to protect it. A friend of mine works at Stanford in the compliance office, and every, you know, so many days she's on call, and she's got the compliance phone and the laptop. And we go into a restaurant for lunch or something, and she's got it with her. She's not allowed to leave it anywhere. Really interesting. All right, guys. So here's a little bit more information. a lot of text on the screen. I think I have a link out to, I know I have a link out to these links to NIST and the FIPS 140-2 regulation around encryption, that kind of thing. The thing to remember here, hint, 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 is you have to render your PHI unusable, unreadable, or indecipherable to unauthorized individuals. And that's the key. That's what encryption does, right? And we're talking about, ideally, if people are allowed to save data to a thumb drive, like I have a thumb drive here today, that should also be encrypted, right? Or you just turn that off totally. They can't save anything to their USB port. You know, there's a way, you know, you IT folks are great at figuring these things out. You have to try to impose as many limitations as you can to protect PHI. Because people are people, and they're going to do whatever they need to do to get their job done. And you have to kind of protect them from themselves. Let's see here.
Some questions coming in on
Okay.
just encryption.
Yeah, first there's, going back a bit, can we get an example of a sub-agreement?
Sure, we can post that. You're taking notes, right? Are these notes, Randy?
I got it.
Thank you.
Can anyone recommend any encryption software?
Well, actually, we have a couple more slides coming up about that. Maybe after the slides we talk about, then we can have some discussion. How's that? Okay.
We'll keep the questions.
Well, that's okay.
Okay. Has anyone heard about the new Department of Mental Health regulations in regards to having to encrypt all data at a Department of Defense encryption level?
So that's the California DMH, is that what?
Maybe you have a slide, Sherry, but it is 256-bit encryption is required.
It's recommended. I mean, I think that's the DOD is 256.
NIST anyway.
Yeah. I think, yeah, 256 is definitely recommended. I'm not sure if it made it to the requirements list. Did it already?
Well, I double checked, but I thought it did.
Yeah. I have links out to these specific regulations that you all can refer to. We won't go into detail on those. So some encryption options, and not sure how many folks have Mac in their agency or that they use today, but the first couple slides are about Mac, and it's about encryption options. There's a software called File Vault that comes with the OS in Mac, and it encrypts the database, or the laptop, essentially. It has the 128-bit encryption, but it's really recommended to go up to 256. You have to have OS X Lion or later, or maybe it's probably OS 10. I'm not a Mac user. And there's a link that you can link out to that takes you here to Apple support that talks about that, if anybody is a Mac user here. One thing to think about, too, is the size of your organization, either Mac or Windows, right? And if you have, 100 people that you have to worry about, 100 devices you have to worry about, it's probably a better idea to get like an enterprise-wide system to do your encryption, as opposed to going to device to device. You do have to have a couple things set up if you do that device-to-device support. You have to have the administrator account that runs everything, and you have to set up the security so the users can't override that encryption. So I'm not sure about folks. I know we're small counties, so some people might just have 50 to 100 devices, and it might make more sense to do it manually. But if you're too big, or if you're bigger than that, really consider that enterprise-wide solution. Enterprise management.
There's a question about has any enterprise solution software vendor recommendations?
I'll have to get back to them on that, yeah. Well, I have one called Nessus, I believe. We should do that in the next slide. But let's write it down and then we'll get back to them on that. And here's just another slide about setting up your Mac and how you do that in File Vault. Now this is a report out of a Mac, but what's important about this is it shows that the device is encrypted, right? So even though it says Mac, you're going to get something like this out of Windows as well. The auditors are going to want to see this, and they're also going to want to see that your encryption keys are saved off in a secure spot. You can do that in AD, in a secure folder, or you can save them off somewhere else, but they need to be separate and secure, right? Because auditors will ask for that.
Well, should you lose a laptop, for example, you will have to be able to prove that that laptop was encrypted, hence the need to save off the keys and show that that was done. And once you do that, fine. But if you can't prove that laptop was encrypted, it might as well not have been. They're going to look at it as a risk.
Yeah, good point. And you'll have to report it as a breach.
Mm-hmm.
And who can tell me what happens if it's more than 500 patient records?
Go to the newspaper.
Newspaper, very good. And the Wall of Shame, right? We should look at the Wall of Shame before we go.
Yeah.
Okay, now a little slide about Windows. As you can tell, the person that put these slides together is a Mac user, right? But enough about that. Windows does have an encryption feature embedded in the operating system called BitLocker. Now, I know some people complain about BitLocker, but we're talking about freebies, all right? Something that's included in your OS. And what we can do is get some other information out about some other, if you're interested, products to buy. But if you're trying to get by on a budget and you just need to do something to meet the encryption standards, then this is one for Windows. It's called BitLocker. You do have to have a certain level or type of OS. Windows 7 Enterprise or Ultimate, Windows 8 Professional, or Windows 10 Professional. If you go down to Windows XP or 7 Home Edition, that kind of thing, it's not going to work. XP is not supported by Microsoft anymore, so you're not going to get any patches, and that's a big risk. Yeah, I know. A lot of people love it, though, right? They don't want to give it up. You're going to have to go and turn on the TPM module, and that might require some BIOS auditing or edits. And you may need to go in and modify your group policy. And it sounds like if you get a certain error about a chipset error when you try to activate this, then you're going to have to go in and modify the TPM. Has anyone used BitLocker here? Yeah?
We use it countywide.
Okay, great. Do you find any issues or any tips about using it?
No, I mean, you have to make sure the machines you're deploying have that TPM module. And you just manage it through Active Directory, so it's all centrally managed, which is good.
Oh, good. So you can do it enterprise-wide management.
Yeah.
All right.
There's a couple of comments. For BitLocker, you'll want your IT department to disable the user's ability to turn off BitLocker.
Good.
It can be done via Active Directory. And Shasta County uses BitLocker.
Okay, great. It works good, and it's part of the OS, right? Well, again, we talked about an enterprise encryption management solution. Sounds like BitLocker, you can do it enterprise-wide, so that's good to know. I'm not sure about File Vault, but I don't think many counties use Mac, do they? Not sure, but okay. Either way, what's important is that you have your devices encrypted. I know we talked about prioritizing mobile devices all the way in, I think that's a great strategy, but your end result should be desktops, laptops, and eventually your servers all need to be encrypted. You might have great security set up in your server room or your physical security, but there's always a chance somebody can get in. And it just gives you that extra level of security. There's also, you know, the way you can securely share files. We use ShareFile, that Microsoft solution. We use it with PIVHS and many of our other customers. So we can send and receive files to each other securely through the ShareFile solution. It works really well. It works really well for secure documents, you know, which include PHI, and also even file size. You know, if you have a really large document that you can't email, you can have this repository to share securely. Now, you might all have something set up in your counties to do this, and that's great. But if you don't, think about ShareFile.
Are there any recommendations to encrypt mobile devices?
Yeah. We actually had Dawn in the room that was talking about that earlier. So, Dawn, do you want to share kind of your experience?
Well, we use a product called FiberLink. Their software product is called Mass 360. And I know FiberLink just got purchased from IBM, but we've been using the Mass 360 product for almost a couple of years. And it works well with our inventory system, and it works well with any lost devices. We can reach out and wipe and try to locate and encrypt as well. So Mass 360 is what we are using. There's other products out there, but this is the one that we chose.
And you said it's $8 a user per month?
That's approximately $8 per device per month.
Per device per month.
Yeah.
Good. And did you say this already? I'm sorry, but you can go in, if a device is stolen, you can go in and wipe it clean.
Yes.
Yeah, and part of that, too, is having your staff sign the BYOD or bring your own device authorization, where they understand what's going to happen, you know, what the rules are around them using their own devices. And if it's lost or stolen, it's getting wiped clean. A lot of staff have a hard time with that. But we have to somehow protect it, right? We have to protect the PHI.
Got another comment or question.
Okay.
I'm very interested in commonly used methods similar to your example of Microsoft ShareFile. Can you please have others explain what they are using?
Okay. Anybody else using some other encryption tool other than BitLocker or File Vault?
ShareFile is more for exchange of PHI, encrypted email systems. What else might people be using?
I have a link. I thought I was talking about it in one of the slides, but on our resources, I have a link to a solution called I thought it was Nessus, but I don't know.
Someone online says they use Mimecast for encrypted emails.
Okay. Good. Anything else anyone's using?
Oh, there's a bunch more. San Joaquin uses Box Enterprise for secure file sharing, Sophos and Checkpoint for endpoint encryption. Checkpoint endpoint security.
Box just this last year announced that they were HIPAA compliant. So Box is a good product. It's kind of a Dropbox product, but it's HIPAA compliant.
We use PGP.
Sure.
PGP?
Wow.
No. You know what that is?
Yeah.
Okay, good. Well, a lot of information about, a lot of interest about encryption, and that's great because, like we said, it's your get out of jail free card. around lost devices. Is that it? Should we move on?
Yeah, we're good.
Okay. One of the things I wanted to talk about today was the safe harbor rule, and that's a rule that is part of the HITECH Act. And I guess earlier this morning I was talking about HIPAA and I said HITECH, and I apologize for that. HITECH is another whole set of rules and regulations around security and different things like that. They talk about safe harbor in terms of encryption. And this is where you have the backup that if you have a device that's encrypted and it's lost, you don't have to report it as a breach. And you've got those same three words that, you know, are really important. Hint, hint. That it's unusable, your PHI is unusable, unreadable, or indecipherable to any unauthorized person. And that means you don't have to report it as a breach. So that's kind of your legal way to back that up. Also included in the safe harbor is how you de-identify data. So if you ever report data out to a grant funder or a research project you're working with, and you know you're supposed to de-identify the data, there are rules about that. You can't just take off the name or the social security number and send it along and think that that's okay. There are very specific rules about it. It's in the Privacy Rule, and I put the number there. I don't know if anybody's geeky and wants to go check it out, you know. But some of the rules are about zip codes, and I thought this was kind of interesting. Kind of similar to what we said earlier about the 89-year-old guy living in a small geographic area. If you've got someone in a small zip code, and you give maybe more than the first 3 numbers of a person's zip code to, and you say it's de-identified, but you give them the whole zip code and maybe, you know, their diagnosis and their age, you could be identifying that person to somebody. So this de-identification rule says that you have to only use the first 3 digits of the zip code. You have to have certain IDs that you remove, and you have to look into your EHR and all the data. You can't just send it with certain things removed. Like you might have a text field somewhere that includes some PHI that no one remembered, and it can go off in the file, and then you'd be in trouble. So there's other rules about it, but if you ever have an event or a need to de-identify data, then you need to look at the safe harbor rule, and it's very specific about how to do that. And if you ever want to reach out to us to ask us about it, we're happy to answer some questions. Any questions on that? Does anybody have research projects or things that they're reporting out to right now? No? Okay. You guys are probably way on top of this, and I don't have another poll to find out, but we're going to talk about a little bit computer and laptop security. Some of those policies are related to workstation configuration, how you detail the documentation of all those images or configurations that you have if you have different ones. HIPAA wants you to periodically review those to make sure they're still compliant, if you need to change anything. Some of the ways you can review those, you can use, oh, here's the Nessus. It wasn't encryption at all, was it? The Microsoft Baseline Security Analyzer. Does anybody use that? And then that's where I was getting, there's a remote scanner that looks at the validation of your configurations, and it's called Nessus. And I have a link for that in the resources. Really important to keep on top of the group and the local policies, your registry settings. And I'm sure everybody here is up on patch management. You all hate Patch Tuesdays. But you're going to hate them more when Windows 10 rolled out, trust me. But that's really important. Stay on top of that. We talked a little bit about workforce training, and IT really does have a hand in that, even though, you know, you might not consider yourself part of that. Maybe you do. Don's shaking his head.
Well, we have a connection.
Yeah, good. Yeah, a connection to your workforce trainer is what is important. If you don't, you know, you're probably not going to do the classes themselves. But what's really important is that everybody be trained on acceptable use. That means, how do I go out and work in the internet if I'm allowed at all? Some people lock that down. Other agencies open it wide open. What do I do if I get an email that says, click here for an exciting trip? What do I do if I see something that says download? Download the latest and greatest, right? There's all kinds of things out there that are going to catch you. Acceptable use training will kind of try to mitigate some of the risks. Because if they have it in their head and they see it, they might think twice before they do it. What do they do if their workstation's unattended? You guys probably drum that into everybody's head, but that's another thing. It has to be part of training. The password, the configure, the up to industry standards, that configuration. Use of mobile devices, we've been talking about that a lot today. They should be trained. If they're going to be using their own device or a county device, how do I do it? What do I do? How do I protect it? How do I dispose of media? That can be anything from a thumb drive, a piece of paper, you know, a file, whatever that might be. That should all be part of your workforce training. And the big one, how do I report an incident? And you should have that whistleblower clause somewhere, and maybe most counties have unions that cover that, but you don't want to retaliate against somebody that does point something out, right? That's really important, because you have to have an open kind of environment. And if I see that Randy's messing up over and over, I've got to be able to. Probably more likely he's going to see me messing up, right? Okay, any questions about that? No? Okay. And that's just high level. I know probably all the IT people in the group have way more suggestions or ideas. The important takeaway here, though, is on top of your verification and validation that the devices are secure, you definitely need to have a hand in your workforce training. And if right now, if you don't, from IT, you need to talk to somebody. Say, I've just been trained and I need to do this. So lots of information today. Let's see, we're doing okay. I wanted to try to end to give people time to do the exam right now too. Compliance strategies. So now this is kind of on the IT side of the house, right? You need to do your security risk analysis. What did I say? That was the #1 thing that you should do, right? Because that's going to get you a lot of leverage if an auditor comes on site. Those darn policies and procedures, again, we got to look at them. We got to make sure they're compliant. And even though this is security, they're just as important, if not more. We talked about your contingency plan. Make sure it's up to date and that you can test it. Test it real time as well as tabletop. Take a look at your physical security, although it seemed like folks are pretty well on top of that. But still, it's not bad to take a look at it. Look at your contracts again. Make sure your business associate agreements are up to date. Refer to the template that you're going to have available and check that out. And schedule staff training or get involved with your trainer and make sure that staff are also trained on all those things we just talked about. And it's okay, I don't know if you do this today, but to send out reminders, send out little tests, you know. Give somebody a Starbucks card if they pass the test that week, or, you know, whatever it is. Get people talking about it, because that's the way they get it ingrained in their head, what not to do, right? Or maybe what to do. I guess I should frame it positively, huh? There you go again. Create that culture of compliance.
I can just add on training real quick. It is important, certainly, to do it with new hires. hires as they come in the door, but it's also important to do it annually with everybody. And it's important to make sure you're keeping logs of the training, of who attended, because it does happen, situations occur, and a staffer might say, well, nobody ever told me that. But you've logged the training, and now you can say, yes, we did. So it protects you guys.
Good point.
So yeah, make sure that's an important part of this.
Very good. And those reminders that might come up, have a screensaver. I don't know if you all use screensavers there. You know, have something come up that reminds somebody about a HIPAA regulation. You don't have to make it as dry and, you know, maybe boring as these classes were, but, you know, something fun. You know, what do you do? A scenario. What do you do if? And just give them the answer and say, remember. You know, keep it in everybody's head. I think a lot of clinicians understand confidentiality really well. Don't you? I mean, yeah. It's sort of ingrained in everybody. This is just taking it that next step in terms of the electronic PHI and all of our PHI, to treat that as carefully as we do our clients.
I had a question.
Yeah.
If you do those little like tests here and there, is that considered kind of what you were talking about earlier, the supplemental, that kind of stuff?
It would be.
Okay.
And you just have to have somebody document it, like the Workforce Security Rule. They could document that. We talked about it in the staff meeting today. We put a screensaver up today. You know, that's perfect. Yeah. Alrighty. It's been a long day. I know in the room we're kind of dragging. I'm sure out there you guys are too. We really appreciate the partnership between our two companies, XPO and CIBHS. It's been great working together. I know it's been a long relationship, but this is fun. That's the end of the technical class. You can always reach out to me if you need anything. I'm sure Shoshana or Kelly will take emails too. So there's an exam for this one too, and you know, we are making some changes to things, but those of you at computers, please take a minute and do the exam. You know, we're ending a little early, so you have some time within your time you scheduled for the class. I changed it up a little bit from this morning. I really probably should have done this better this morning. What you're going to do is you're going to do that registration, and then you sign up for, in this case, it'll be the technical training. And then you don't have to take the class. You just take the exam.
Is it possible maybe to run through one? And there was a question online. Somebody was having a challenge getting to the print certificate.
Okay,
So
yeah.
maybe it'd be just good to show everybody if we can.
Okay. Yeah, I will do that. Okay, I kind of explained it here, and let's see if we can do that. I have to log in as somebody, right?
Just add me as a person if you want.
Let's see. Boy, everybody really cares about my email. Okay, so it was HTTP. CIOhealth.com/CIBHS. See, I learned. It's funny, that one little thing is like, that I'll always say that, you know?
I think you have to do XPIO health.
Oh, you're right. Didn't I do .com? I said it, didn't I? I just didn't do it. There.
Org.
.org? Yes, it is org, isn't it? Great. No wonder you're having trouble, huh? I can't even do it.
XPOhealth.org and get rid of that XPO.com up front.
Darn it. Start over. Yeah, really. Okay, don't cut me down on my, whatever, satisfaction survey for this LTH.org, CIBHS. Ta-da, success. Okay, so this is the one we're talking about here. It's a free purchase. You don't have to put too much in, but you have to set up an account so we can track that you did it. So it's check out, and I'm going to do a new account. So Randy, you want us to do you?
Sure.
Okay.
RANDWILLS@gmail. Let's just use that one. Make it new.
Is that right?
No Y. Yeah,
No Y?
on the email.
Okay. Create an account is optional. Should we just try it?
Yeah.
Then you get the free download. It wanted it, didn't it? Hang on. So it looks like it really isn't optional. So it looks like you do have to create an account, even though it says it's optional. Okay, let's do it again. Check out. I wonder if it saved it. Okay, well, Gracia, how about, want to just do the same thing? How about Randy will?
Sure.
1, 2, 3, 4, 5.
HIPAA compliant.
Is that a HIPAA compliant password? Okay. Should work this time.
You hate that.
Oh, that's funny.
See, Randy Wills 1.
That's funny. I must have created that for you. Well, I don't have the password though. Interesting. I'm going to get another error, I'm sure. Oh. Well, that's interesting. Okay, click on the class. Maybe our guys behind the scenes are saying, let it go, right? She's demoing. Okay, remember you don't have to take the class, just take the exam. And click here to launch the exam.
Give them a bonus and go through it. You have to pass because this is going to show the process.
That's what, yeah, we can do that. Okay, let's answer it together. Everybody online, do it with us. In the class, we're just going to kind of do it together. Approximately half of the HIPAA security rule requirements are in what safeguard section?
Administrative.
Admin. Yay. Okay, there's my little. Okay, yeah, I've got, let's see, how did you redo, how did you, the Zoom, is it here?
Well, you can see the submit, so you're okay.
No, I know, but I'm going to have to mess with it every question. Every organization must conduct a security risk analysis, confirm all PMPs are HIPAA compliant, train staff on security standards and rules to protect EPHI. Is it A and B, or is it all of the above?
All of the above.
All right. Good job, guys. Okay, the security rule is made up of 4 safeguards: administrative, physical, disaster, and technical. False? Everybody agree? Correct. Okay. The organization has decided to begin the HIPAA compliance efforts to make sure ePHI is safe and secure. The most important requirement of the security rule is to complete first is confirm access control to all systems is defined and implemented. Review all contracts that have access to PHI and confirm there's a current BAA included. The security risk analysis, or confirm that your EHR software vendor contract includes protection for your agency's security rules. Security risk. Remember, they're all important, but we said that was the first thing to do. And your auditor's going to look at that too. Okay, the standards in the security rule must be followed as written without exception. Is that a trick question? Randy's going to kill me. I like trick questions.
Better get 100% there, Sherry.
Every covered entity.
Why was it false?
Oh, because it says must be followed explicitly without exception. And remember, it's flexible.
Some are addressable.
Some are addressable. There's a little bit of flexibility in there. Every covered entity or business associate must follow the security rule regardless of size. I tried to change things up a little bit. Okay, the contingency plan is included in the technical safeguards. That's another one. I'm not even sure right now. I think it's false. It's in the administrative.
Okay, thanks. I wasn't.
Media reuse and disposal controls are included in the physical safeguards. True? Okay, encryption is coded as addressable in the technical safeguards, which means CMS was not up on the latest technical standards, and this was an error. Encryption should be coded as required or are. Encryption is not required, but if I choose not to activate, I need to explain why it doesn't fit for my agency or explain an alternative way to meet encryption. Or C, encryption is not required and I don't have to activate. B. Rectamundo. Okay, all of my contracts should have a current BAA to protect my client's PHI. All of my contracts. Oh, very good. You guys are getting another way. Or maybe I'm just giving hints like Randy said. Okay, I don't need to report a breach if a laptop that contains ePHI is stolen if there's a 4-character password that's been entered before the laptop can be used. My data is unusable, unreadable, or indecipherable, or I've logged the laptop into my mobile device log. B. Need to add an is to that. Auditors will review my encryption logs to confirm my devices are secure and users cannot alter the settings. True. Encryption is my get-out-of-jail-free card.
Safe harbor.
That's right. Safe harbor. A culture of compliance means, and you can select as many as you want here, my policies and procedures are current with HIPAA regulations. My contingency plan is up to date and tested to make sure our agency functions in the event of a disaster. My staff understand the importance of keeping PHI secure and have received training on security standards. And my contracts are renewed and BAA added if the person or agency has access to my PHI. Oh, should I check them all?
Good.
All right. Is that a good summary? Ta-da! Look at that, we got 100, you guys.
Am I good?
Are we all going to get a that says Randy
Yeah.
on it?
Yeah, right. So.
Oh, yeah, and I'll show them though what's the steps and how, because
I
there's a
will.
couple of nuances.
I will.
Yep.
So you can print results here, and if you do, it's a very detailed page about each question, what you answered, what was correct. If you need that kind of detail for your HR department, go for it. You can review your quiz, so if you miss some. But all you have to do here is click the X, and see when I say go to your dashboard, this is like, go to the dashboard, which is the link up there, and it's going to kind of take you back down here. What we have to do is get back to the exam and open that guy up so you can get your certificate. And we're going to try to make this a little bit more user-friendly. Okay, see, I've got a green check next to my exam. So if I go in there, I see my print my certificate link right underneath it. So it has to go through all those refreshes to get to the certificate.
Yay.
Yay, you did it.
Can you mail me that?
And you know what I'm going to do is we can put it on the web too. It's kind of those detailed instructions because we did kind of have some funky things happen today and we don't want to confuse everybody. So there you go. Any questions coming in? We're giving you guys a little time back on your day. I'm sure people appreciate that. It's been a lot of information. We'll have information, all the documents out on the website by next week.
And the recording.
And the recording, okay. Reach out if you have any questions for me, specifically. We're going to actually get all the questions from the webinar and get those out there too. Yeah, so that'll be good for you guys to have. Is that it? All right, thank you all. Give yourselves a hand.
Thanks, everybody.
Make sure you fill out your evaluation.
Evaluations, and how about online?
Kelly, are they,
Everybody online will be sent a link.
everyone online will be sent a link so that you can complete an evaluation, and please do so.
Please do so. We want to know what worked and maybe what improvements we could make too.
You guys, there's a funny little internet kind of quiz. You can set up with like 4, 6, 10 questions, whatever you want. So when you're kind of rolling out things like HIPAA, things like your staff will be like, what are you going to give us now? It's kind of a fun way to kind of reduce their mobile device. You kind of do a team little quiz. And if you have a projector, you can like project it to the wall so everyone kind of see what the scores are. It's kind of just a kind of fun kind of way to kind of give them something that's like, really, we're going to do HIPAA again. It's kind of just so,
What's it called, Laura?
It's called Kahoot. So it's, I think it's, I just texted my friend, what's it? Kahoot. And it really is kind of fun because even though like Ken and I can answer the same question, he may get A faster than me, so he may get more questions right than I do. But we'll answer the same way. So it then becomes a competition. You give them like a little Starbucks card at the end. It's kind of fun.
Right.
Use it for
That's a
whatever.
great idea.
I
Thank you.
know.
Thank you.
I know.
Check it out.
They hate me at work, but I do weird annoying things like that all the time.
Well, you got to keep it fun, right? Or else.
Yeah, and then they laugh, and it's not so bad. And then you have your little thing for your audit.
That's
And
right.
yes, we did the same thing.
That's right. Well, thank you, everybody, for being here in person, and thank you for everybody out on the web, too.
Thank you, everyone. Oh, we were still on.
Okay. Go ahead. Should we close it? Okay.
Oh, no.
I'm going to end in a second.